colorful ng beginning natin. Ano?
That's right, partner. It feels so good to be back here in UC. This has been my home for 4 years at the College of Law, but it feels a lot better to be part again of Dagyaw 2023. Wow, napakagandang presentasyon. Palakpakan naman po ulit natin.
Napaka-colorful at napakagandang reminder ng ating cultural heritage bilang mga taga-Baguio.
That's correct, partner. That was the UC Saang Yakasay Cultural Ensemble, which is of course headed by Director PJ Natiola. Maraming salamat. And again, good morning sa ating mga participants, both physically and virtually. And welcome to the Dagyaw Open Government Townhall Meetings 2023. Partner?
Ayun nga po. So, naimbag nga aldaw kada kayo amin. We are so excited to welcome you because for Season 1, Episode 1 of Dagyaw 2023, we have organized a panel of experts who will speak on a topic that hits close to home. Ito ang kalusugang pangkaisipan o mental health.
That's right. Actually, we are very grateful for this episode because other than government agencies, we will also be joined by civil society organizations and mental health advocacy groups who will also share with us their perspectives on the different government plans, programs, and policies.
Ayun. So bago tayo mapadpad sa ating program partner, magpapakilala muna tayo. So ako po, I am PJ D. Bengwasan of St. Louis University. I'm a psychologist.
Yes, and I'm Attorney Joanna Guyagoy of NIA and Pansikadan Advocacy Cooperative, and we will be your moderators for the Dagyaw Episode 1, Season 1.
Ayan. So welcome po ulit sa ating lahat. Palakpakan po naman natin ang ating mga sarili. Ayan.
Of course, gusto rin po nating batiin ng isang mainit na umaga ang mga kinatawan ng mga different regional line agencies, civil society organizations, and of course, punong-puno po ang venue natin ngayong umaga. Napakadami pong mga estudyante. Kaway-kaway naman po mga students. Ayan. And of course, other than students, we also have teaching and non-teaching staff from different from all over the region. At magandang umaga po sa inyong lahat. Muli ay maraming salamat for joining us for this episode.
Yes, and indeed, your presence here means a lot to us as we strive to make our government plans, programs, and policies inclusive, and not only that, all the planning processes participative as outlined in the Philippine Development Plan 2023 to 2028.
Yes, partner. Talking about inclusivity and participatory, we are being live streamed. Live po tayo. Yes, live na live po tayo sa Facebook via the PIE Cordillera and DILG Cordillera Facebook pages. Kanina po, nabanggit ni Sir Rene, magkakaroon ng paraffle. Whoever is the lucky sharer of our live stream, because our intention really is to reach as many audience as possible. So please do share our live stream, again, via PIE Cordillera and DILG Cordillera Facebook pages. Of course, we are also joined virtually by LGUs, our LGUs and colleagues from the different government agencies who are currently tuned in right now. Magandang umaga po sa inyong lahat.
Yan, magandang umaga po at sana pala nag-share din tayo para part tayo ng raffle. So kung gusto niyo manalo sa raffle, i-share lang po natin ang link for our live stream for today. So with that, let's start our program. So to formally welcome us to Season 1, Episode 1 of Dagyaw 2023, to deliver the opening message of Regional Director Araceli A. San Jose, please join me in welcoming the DILG Cordillera, Assistant Regional Director Roberto B. Maribay, Jr. Let's give him a round of applause.
Thank you. Thank you. Maraming salamat po. Of course, to our handsome and beautiful MCs, Dr. PJ and Attorney Joanna. Maraming salamat po. Magandang umaga po sa atin lahat. Naimbag nga bigat kadatay amin. Of course, to our partners from the different regional line agencies who are here, from the DBM, from DepEd, and the DOAs, and of course, our partner from the PIA, I should say. And of course, our very active partners from the civil society organizations and local resource institute, no? Mga schools, academe, and other stakeholders who are here. Hindi ko na po kayo maisa-isa, although some are familiar to me. And to our students, mga mag-aaral na nandito po ngayon, and their teachers and non-teaching staff of the different schools in the Cordillera Region. Muli, magandang umaga po sa atin lahat. Our Regional Director, R.D. Araceli San Jose, could not make it this morning because she is right now with an activity of the Local Government Academy outside the region. And that's why I'm here to deliver her opening message. Isang magandang umaga po, mga kadagyaw. Before anything else, I would like to thank all the representatives of various civil society organizations, our students, and teaching and non-teaching personnel from all over the region who are joining us today. Your participation is a testament to your commitment in exercising your right to participate in local governance. I would like also to express our gratitude to the representatives of our regional line agencies who are with us this morning from the Department of Health, CAR, and the Department of Education. Thank you very much for making time to join us to share your agency's plans and programs to our stakeholders. Also joining us this morning are representatives from the DILG's support for the Local Governance Program, Project Management Office. We call it SLGP. We have here Miss Angelica Apostol, mga kasamahan namin sa DILG Central Office, and Miss Larissa Muhi. No, maraming salamat for joining us here. Thank you for the SLGP's unwavering support to the activities of DILG CAR. At syempre, maraming salamat po sa University of the Cordilleras, headed by the President, Dr. Nancy M. Flores. Palakpakan po natin ang President and the other officials of the University of the Cordilleras for being our partner in the conduct of the Dagyaw 2023. I would like to also express our thanks and appreciation to the group of students who have that special participation, no, a while ago, from the prayer to the dance rendition kanina po. So pwede pong palakpakan uli natin sila. We would like to recognize the members of the members of the Cordillera Regional Technical Working Group. Palakpakan po natin ang ating Regional Technical Working Group composed of the different agencies, civil society organizations. They are the ones behind this activity. Our speakers from the development sector, no? Maraming salamat po, no? Our DILG field personnel, LGU officials, and functionaries who are right now in the online platform, our local chief executives, our friends from the media, and those who are joining us virtually on Facebook. Naimbag, nabigat kada kayo amin, and welcome to the Cordillera Dagyaw Open Government Town Hall Meetings 2023. Good governance stands firmly on 4 core values, namely transparency, accountability, inclusivity, and most importantly, participation. Citizen participation in local governance is enshrined in the 1987 Constitution as the state recognizes our CSOs and NGOs' ability to articulate and lobby for the needs of the sectors they represent. This is in addition to their capacity to augment local service delivery and in providing us with data to complement our local planning and decision making. In other words, it manifests the notion that people are better heard if they are recognized and organized. This is exactly why we have the Dagyaw Open Government Town Hall meeting. It is an opportunity for our citizens to take up spaces that is intended for them by the government. More than being just a town hall meeting, the Dagyaw is a celebration of inclusivity and citizen participation. It is a convergence of sectors and government institutions. It is a catalyst for co-creation fueled by our collective clamor for genuine change. It is a platform for elevating the discourse on the issues that matter to us, issues at the grassroots level, and issues that we in the government need to act on. By providing a safe and open space for dialogue, we can push for improved local service delivery and demand-driven programs and services. Moreover, the Dagyaw is a centerpiece of the department's commitments in the Philippine Development Plan 2023 to 2028, where we push for deepened citizen participation in local governance. As a proof of this commitment, we are proud to share that 3/4 or 75% of the Regional Technical Working Group of this activity in the Cordillera is composed of the civil society organization representatives, and we thank them for their untiring participation in our planning, decision-making, and implementation of this program. Pwede pong palakpakan natin po ang ating mga partners from the civil society organizations. While the DILG has implemented various programs to strengthen the capacities of citizens to participate in local governance, a lot is yet to be done, but we assure you we are doing our very best to open more spaces for citizen participation. We are enjoining our CSOs, both physically and virtually, to let your voices be heard through this activity. Makiisa po tayo sa mga talakayan dahil importante pong kayo ay marinig at makakaasa po kayo na kayo ay aming pakikinggan. We are all aware of the values of here in the Cordillera, the Binadang, Baddang, Ogogfo, Aduyon, and Abuyog. We may call it in many different ways of our dialects here in the Cordillera, but the meaning remains universal, and that is bayanihan at pagtutulungan. We have great hope that our discussions this morning will be constructive, peaceful, and engaging. Let this be a starting point for collaboration and co-creation as we collectively strive to push for people-oriented and service-oriented local governments. Once again, on behalf of our Regional Technical Working Group, and on behalf of DILG Cordillera, welcome to the Cordillera Dagyaw Open Government Town Hall Meetings 2023. Maraming salamat po. Good luck and God bless everyone.
Thank you very much, Assistant Regional Director Rupert, for that inspiring opening message. So truly, CSOs are the government's partners in development, and we are fortunate that we have their support in these programs. Di ba, partner?
Yes, partner. You know, true to the essence of democracy, the voice of the people is really very important. And Dagyaw, which is one of the many programs of our government to actually listen to our citizens. Again, Assistant Regional Director Maribay Jr., thank you very much for that message.
Ayun, at marahil ay bago ang karamihan sa atin sa Dagyaw Open Government Town Hall meetings, including ako. Kaya that's why to give us the overview of the Dagyaw, ladies and gentlemen, representing DBM CAR, Regional Director Irene B. Gahid, please welcome Attorney Noemi P. Humilde. Let's give her a round of applause.
Thank you, Dr. PJ, Attorney Joanna. Okay. Magandang umaga po sa inyong lahat. I'm happy to be here dito sa University of the Cordilleras. Okay. Actually, I'm also a law faculty, no? Faculty of the College of Law. So, dito rin sa ating university. I'm happy meron ulit mga estudyante akong nakikita kasi we are on a summer break. Okay. A peaceful and prosperous day to everyone on behalf of the Regional Technical Working Group of Dagyaw 2023 and also the DBM Regional Director, Irene Gahid, who is currently in Ifugao, na accompanying our Secretary. Andun po kasi siya sa commencement exercises ng Ifugao State University. We would like to express our profound gratitude to all regional line agencies, okay, representatives from various civil service organizations, society organizations, and our dear students, ang bida po natin sa araw na ito, for your participation in this town hall meeting. So ano po ba ang Dagyaw? Okay, so this Dagyaw, no, it began in 2019. The Dagyaw Town Hall meetings has become one of our most anticipated spaces for safe, open, and protected dialogue between the government and the Filipino people. So pag sinabi nating Dagyaw, ang ibig pong sabihin niyan ay bayanihan. So it is a Hiligaynon word. It embodies the objective of this activity. Anong objective natin? Co-creation between the government and civil society. Ulitin natin yan, co-creation, okay, between the government and civil society. So hindi na po yung common notion na government lang ang involved sa mga programa. Gusto natin involved na ang civil societies. Okay, we have seen the persistence of our national government in promoting an impeded dialogue with our citizens through Dagyaw. Okay, the COVID-19 pandemic prompted the transformation of this program into virtual or online, diba, town hall meetings. Probably you have seen or you have watched na in 2020 and 2021, online po tayo. But for now, for this year, we are very excited. We are glad to bring back Dagyaw to where it belongs, okay, to whom it belongs, and this is to the people. So we would want to conduct it face-to-face. We have maintained this program because you, our beloved citizens, are our co-equals and co-partners in development. Okay. This year, Dagyaw is guided by the theme, Building a Better Government Citizen Engagement, Quality Public Participation and Dialogue. Okay? Building a better government, citizen engagement, quality public participation, and dialogue. True to the essence of any functioning democracy, Dagyaw remains faithful to its promise by having our development partners beside us in the driver's seat and empowering the people to decide on the topics that we will all discuss in the regional town hall meetings. So, hindi lang po biglang na-conceive ang mga ideas na to, kundi in-approach natin na ang taong bayan, ang madlang people, kung ano ang gusto ninyong pag-usapan. So the topics, okay, of the Regional Technical Working Group selected are in line with our quest to build back better from the COVID-19 pandemic. Thus, we invited key government officers and developmental sector representatives to discuss their respective programs to guarantee our citizens that the government is doing its very best to help the Filipino people. So we are excited to inform that for 2023, Dagyaw will be staging 2 seasons. Okay, so the first of which is ito po, now this meeting that we are conducting, and the second one is slated next month, no, July 2023. So Season 1, Episode 1 is titled Usapang Mental Health Concerns and Interventions. This won by a landslide in the public voting on social media. So kinuha natin ang pulso ng taong bayan at karamihan, mga estudyante nag-respond, gusto nila usapang mental health. So this only reinforces our belief that mental health is of paramount concern, especially in our youth. We heard the news and the stories in recent months regarding the mental health status of our students. So we deem it important to bring this matter closer to you, our youth. This episode wishes to send a message of hope. Okay. A message that help is here and that help is available. And hopefully, it resonates with all of you. Considering this value-laden topic, okay, we are also very eager to hear the reactions of our civil society organizations on the various government programs, projects, and activities to be discussed. Yes, these are vital feedback which can help shape government policies to become responsive to the needs of the constituents. We also encourage the participation of our students, especially that the youth is among our most vulnerable sectors to mental health problems. Help us better understand your situation so that together we can improve local service delivery. And finally, we hope that we can maintain a peaceful and constructive environment so we can create better solutions and promote a harmonious relationship among sectors. Tandaan po natin, ano po ulit ang ibig sabihin ng Dagyaw? Bayanihan. Kaya't sama-sama po nating talakayin ang isyu ng ating lipunan para sa tunay na ikauunlad ng ating bayan. Maraming salamat po at magandang araw mga kadagyaw.
Yan. So thank you so much, Attorney Noemi. Ang Dagyaw nga ay talagang para sa lahat, wherever you are in the region, in the city, or in the country. Kaya importanteng napakikinggan ang ating mga kababayan para mapagpatibay pa ang mga programs ng ating pamahalaan, hindi ba?
That's right, partner. Gaya nga ng nabanggit ni Attorney Noemi, our topic for this episode, which is mental health, was actually born out of an overwhelming response from our respondents na ang gusto nilang mapag-usapan ay mental health. Because mental health-related issues is something that we shouldn't be whispering about or we shouldn't keep mum about. No, it is an issue that we should talk on a regular basis. And of course, we would like to emphasize again the theme of our Dagyaw 2023, which is building a better government-citizen engagement, and quality public participation and dialogue.
At para mas lalo pa nating ma-appreciate kung ano nga ba ang Dagyaw Open Government Town Hall Meetings, panoorin po natin itong maikling video na ito.
Ano ang pwede ming asahan na mga programa para sa mga arog kong mga namamasada, lalo na ngunyan na pandemya?
Unsaon na mo pagkuha sa among benepisyo sa universal healthcare labi na karon nga pandemic?
Ano pong tulong ang maaari naming asahan mula sa aming lokal na pamahalaan para sa mas magandang kalidad ng edukasyon, lalong-lalo na sa panahon ng pandemya?
May mga programa man daw ang lokal na pamahalaan para sa samong may mga kapansanan.
Adda kadi, maiti mainayon a programa tapno maprotektaran ken mapagtalinaod ti kultura dagiti padami a katutubo.
Di may kakaila na napakaraming mga tanong ang bumabagabag sa ating mga kababayan na nakakaapekto sa kanilang pamumuhay. Dahil ito sa dami ng mga nangyayari ngayon sa ating bansa, tulad ng mga pagsubok sa ating ekonomiya, usaping agrikultura at infrastruktura, pagbabago sa sistema ng edukasyon, at higit sa lahat, ang problemang dulot ng COVID-19 pandemic. Saan nga ba dapat itanong ang mga ito upang mabigyang pansin at magkaroon ng malinaw na kasagutan? Sa barangay? Sa kapitbahay? Sa paaralan? Sa internet? O sa mga samot-saring pagpupulong? Sa pangunguna ng Department of Interior and Local Government, Presidential Communications Operations Office, Department of Budget and Management, katuwang ang Caucus of Development NGO Networks, muli nating inilulunsad ang Dagyaw. Salitang Dagyaw ay salitang Hiligaynon ng ibig sabihin ay bayanihan. Bayanihan. Ang Dagyaw Virtual Town Hall ay isang paraan ng pagdadayalogo sa pagitan ng gobyerno at ng mga mamamayang Pilipino mula sa iba't ibang sektor upang mapag-usapan ang importanteng isyung panlipunan. Sa pamamagitan ng Dagyaw, magsasama-sama ang mga kinatawan mula sa iba't ibang ahensya ng ating gobyerno, mga kabalikat mula sa civil society organizations at non-government sectors upang talakayin at sagutin ang inyong mga katanungan. Napakahalaga ng inyong pakikilahok sa bawat Dagyaw Town Hall meetings mula sa iba't ibang panig ng Pilipinas. Tara, halina't sama-sama tayong makilahok, makibahagi at makipagtalakayan sa mga usaping ikaw mismo ay may pakialam.
Sa Dagyaw,
ikaw ang bida.
Sa Dagyaw,
Tayo ang bida! Sa Dagyaw, ikaw ang bida.
sa Dagyaw, ikaw ang bida.
Sa Dagyaw,
Ikaw ang bida.
dito'y Dagyaw, datayo ti bida.
Ayan. Now that we are properly acquainted with what Dagyaw is all about, which of course accordingly is a Hiligaynon word for bayanihan, I think we have to keep the discussion rolling now. But of course, sabi nga kanina sa Dagyaw, ikaw, tayo ang bida. Kaya naman we have prepared poll questions because we want also to hear your perspectives. There are poll questions we have prepared and these are answerable by a simple yes or no. Okay, partner, ano nga ba yung unang poll question natin?
So for the first question, ito naman, is mental health talked about in your homes? O pinag-uusapan nga ba siya sa bahay natin?
Yes, by the way, these poll questions are being flashed on your screen right now. And the second question is, are you comfortable seeking professional help regarding your mental health status? Yes or no?
Are you also aware of mental health related programs and services offered by the government? Yes or no?
And do you think the mental health programs and services offered by the government are sufficient? Yes or no?
And we would also like to know, what are the recommendations or your recommendations to improve the mental health programs and services offered by the government and schools?
Okay, so those are our questions. Please join our poll. Napakadali lamang po nito. Sabi nga ni Sir Rene kanina, meron ding mga QR codes dyan sa inyong mga upuan so that it would direct you to where you can answer the polls. And to join our poll, for especially sa mga nasa online, you either scan the QR codes or follow the link bit.ly/Dagyaw 2023-poll flash on your screen, and later on we will be collecting your responses and we'll share with you the results as we go on with our discussion for this morning.
So hinihikayat po namin ang lahat na sumali sa ating poll para naman makuha natin ang pulso ng Cordillera sa mga katanungang ito. Ngayon, gusto naman namin tanungin, so kumusta ka naman na, Cordillera? At kumusta na ang aksyon upang tulungan ang ating mga kabataan? So, panoorin naman po natin itong video na ito. And while we're preparing, pwede pa rin po natin makita yung mga questions later.
Sa anumang usapin patungkol sa kalusugan, hindi nawawala ang diskusyon sa kalusugang pangkaisipan o mental health. Sa nakaraang mga taon, mas lumakas ang kampanya ng pamahalaan upang tugunan ang mental health problems sa bansa. Kabilang dito ang pagpapasa sa Republic Act No. 11036 o ang Mental Health Law na naglalayong palakasin ang pagbibigay ng iba't ibang uri ng mental health services sa lahat ng Pilipino. Ngunit ayon sa isang survey na isinagawa ng University of the Philippines Population Institute noong Oktubre taong 2022 sa mga kabataang edad 15 hanggang 24, nakitang malaki ang itinaas ng bilang ng mga kabataang madalas nakakaramdam ng depressive symptoms. Dumoble rin ang bilang ng kabataang nagtangkang saktan ang kanilang mga sarili. Ayon sa parehong survey, tinatayang halos 1 sa bawat 5 kabataang Pilipino ang nagtangkang bawiin ang kanilang mga buhay. Kaugnay nito, naalarma rin ang Department of Education sa bilang ng mga estudyanteng apektado ng mental health crisis noong taong 2021, panahong ipinatupad ang mga lockdown buhat ng COVID-19 pandemic na maaaring nakaapekto sa ating mga mag-aaral. Ngayong umaga, ating tatalakayin kung ano-ano ang mga programa at serbisyong ibinibigay ng pamahalaan at ng pribadong sektor upang tulungan ang mga Pilipinong dumaranas ng iba't ibang mental health problems upang magbigay ng pag-asa sa ating mga apektadong kababayan.
Ayan. Kanina, kinumusta tayo ni Doc PJ. Kumusta ka, Cordillera? Kaya kung kumustahin din kita, partner, kumusta ka naman?
Well, ako syempre, tuwang-tuwa dahil mental health ang ating topic for today. But syempre, dahil medyo malalim ang usaping mental health, I'm sure medyo mas-stress ba tayo today? Or matututo or matutuwa? Ayun.
I hope matututo tayong lahat, And of course, kamustahin din po natin ang ating panel members. Joining our panel members, first we have from the Department of Health, Center for Health Development, Cordillera, Mr. Shamgar Douglas Mangida. Sir, kumusta po kayo?
Yeah, thank you so much.
Ayan, masayang-masaya po talaga, pati yung microphone.
Masaya din ang ating mic, kaya na-excite din siya. Ayan.
So, masayang-masaya po tayo ngayon sapagkat nandito tayo upang sa ganun ay pag-usapan ng isang napakalagang topiko na kalusugan sa pag-iisip.
Salamat, Sir Shamgar. Also, of course, we are joined by a representative from DepEdCar. We have Miss May Claire Jimenez. Kumusta po kayo, ma'am?
I'm okay po. So, magandang umaga po sa ating lahat. From our Regional Director, Ma'am Stella Carino, we are very glad na talagang pinag-uusapan na ngayon ang mental health dito po sa Cordillera.
Thank you, ma'am. Of course, we also have a representative from the Philippine Mental Health Association, Cordillera Chapter Incorporated, represented by their department head, Ms. Riza Alma M. Vasco. Magandang umaga, ma'am. At kumusta po kayo?
I feel good. Naimbag nga agsapa kada tayo amin. For everybody who are here and to our online audience. Magandang umaga po.
Thank you, ma'am. Of course, ang kasama ko last years, I know he's a celebrity, na-feature din po siya dun sa Corina Sanchez. I know a lot of people know him already. We have the founder of the Anxiety and Depression Support Group, Dagyaw. We have Dr. Ricky B. Ducas. Kumusta ka, sir?
Hi, attorney. Hi, Sir PJ, Dr. PJ. Good morning, everyone. Iyaman.
Ayan, pre-measure tuloy ang ating celebrity for today. Okay, now to give us a better picture of mental health situation in the region and to promote the programs and services provided by the government, we have from the Department of Health, Center for Health Development, Cordillera, Senior Health Program Officer, Mr. Shamgar Douglas Mangida. Good morning, Sir Shamgar. So he will be presenting to us some of the DOH programs for this morning.
So, again, isang magandang umaga po sa ating lahat, lalong-lalo na sa ating mga kabataan, students who are here. I would like to appreciate your presence and also for the organizers natin nitong Dagyaw na ito, mga kapwa natin sa mga different agencies. Gusto ko pong humingi ng paumanhin sapagkat hindi nakadalo sa atin ngayon ang mahal naming Director sapagkat siya po ay pinatawag ng ating mahal na Yusek doon sa Central Office para sa isang mahalagang konferensya. However, pinapabot niya po ang kanyang pasasalamat at yung panagyamyaman adal iso na ti Ilocano ngay kat kuna naidan mo ti panagyaman kadagiti sa mga kasama natin sa Cordillera dahil ang mental health ay ginagawa ng priority natin at pag-usapan natin sa araw na ito. There are so many things that I would like to share to us in this day, but I would like to focus on this very important issue that is the suicide cases, which is nakita natin ang daming mga incident that happened in the past month, pero hindi lang ito past month, even before, years before, ay ang daming mga nangyayari, pero ang challenge talaga natin ay hindi nare-record yung mga ito. So, for this day, I would just like us to revisit or visit yung mga incidents that happened, reported cases. At mula dito, pag-usapan natin ano yung pwede nating gawin dahil ito ay related sa mental health ng isang tao. And mental health as defined by the Republic Act 11036 or the Philippine Mental Health Law na nakasaad doon that is a state of well-being in which the individual will realize his or her strengths and or potentials and abilities upang sa ganon, kahit na mayroon mga extreme life events, even if there are normal stresses of life, that person can cope and that person can still become resilient, that person can still become productive and fruitful kahit may pinagdadaanan at makapag-contribute ng positibo o magandang mga bagay sa kanyang komunidad. The challenge is if the person is having a concern or having a problem na hindi niya kayang dalhin, hindi niya kayang i-manage, pwedeng humantong iyan sa isang problema at pwedeng humantong yan sa isang sakit sa pag-isip or worse, pwedeng humantong yan sa isang topiko na pag-usapan natin. Next please. Okay. Thank you, ma'am. So kung tignan po natin ang datos mula 2019 hanggang sa first quarter ng 2023. So ito po yung mga nakita natin when I assume as the mental health coordinator ng DOH CHDCAR. We tried our best to gather this data and present it for all of us. So makikita natin dyan, ang pinakamataas po ay ang Baguio City, followed by Benguet, and of course, ang Mountain Province, and then followed by Ifugao and Kalinga and Apayao. So napakataas po dito sa Baguio City. And I am sure na sa atin, marami tayong mga nakita even sa Facebook, yung viral video na yon na isang pangyayari in which we discourage sana kahit yung pag-share yung mga ganon kasi I talked to somebody, even kay Dr. Ricky, na mayroong isa na nung napanood niya ay sabi niya parang gusto kong tularan yung nangyari. That's why even the Department of Health has issued a memorandum na yung pag-report at pag-post ng mga suicide cases ay hindi sana may papakita kahit sa mga Facebook natin. So titignan po natin yung total cases natin. Meron po tayong 508. Yan. Mas marami po ang male. Yan. And ganun din po kahit sa mga top na illnesses natin, mental illnesses natin, based from our reports gathered from the different local government units, sa ating mga rural health units and hospitals. Ang isa na titignan natin ay bakit mataas ang sa mga kalalakihan, sa mga kabataan, pati sa mga kabataan, yung itong sakit na depression, yung mga na-diagnose ng depression. Hindi natin sinasabi na yun yung dahilan kung bakit sila nagsusuicide o kaya nag-commit ng suicide, pero pwede nating i-correlate yun. Mamaya titignan natin yung mga rason. So mas mataas po ang male kaysa sa female. Okay? Kung titignan natin sa age distribution, I'm not sure kung makita nyo doon. Yan, nakikita. Ang pinakamataas ay yung taong ng 14 years old. As low as 14 years old. At sa amin na mga mental health advocate, and I'm sure, or even din sa inyo, kahit isa na tao na mapakinggan natin. Last night, I was talking with somebody na iniisip din niya yung ganon. Sabi, na kipag-usap tayo sa kanila, sa kanyang pamilya. And yung titignan natin sa data natin, 14 years old. Followed by 22. Followed by, kung titignan natin, nasa range yan ng adolescent or young adulthood. Okay? Yung manner na ginagawa nila, top 1 dyan ang strangulation. Hindi ko binibida ang strangulation, ha? Pero sinasabi natin ito pang sa ganon, katulad ng isang nakausap natin, na ano yung paraan na iniisip, ano yung iniisip mo na paraan para gawin yan. Sabi niya, pag gusto kong maghang, kaya kinausap natin yung family, pag ganon, idulin nyo amin dagayat tali. Takastoy ka no tigayat ng aramidan. So, strangulation ang number 1. Second is chemical ingestion. Sa report ng BGH, MC, ang number 1 na tinatakbo doon ay dahil sa chemical ingestion. Okay? Pero overall, sa ating Cordillera Region, number 1 ang strangulation. I'm sure din na may mga napakinggan kayo, nakita nyo, na-witness nyo maybe dahil dito. Another one is multiple drug ingestion, followed by laceration, then self-inflicted wound. We're unfortunate, last week merong isa na report pero that is yet to be verified, na sinaksak niya yung kanyang sarili. Kaya sabi ng kanyang tito, ang tibay naman nito, bakit niya sinaksak yung kanyang sarili? Okay? So, let's take a look at the reasons. Ang daming rason kung bakit ang isang tao ay mag-attempt or mag-commit ng suicide. Pero hindi natin tinatanggal yan ng isang rason ay dahil mayroon silang pinagdadaanan. Meron ba silang history ng mental illness? At kung mayroon silang history ng mental illness, ano ang dapat nating gawin para sa kanila? Nakita natin na based from our own data, although napakalaki dyan yung undisclosed. Undisclosed kasi ayaw nilang sabihin, undisclosed dahil hindi ma-diagnose agad, undisclosed kasi kulang yung time. Pero kung titignan natin, ang next dyan, mayroon silang, may mga nagsabi na nakita natin na sila ay may history ng mental illness. And that amounts to 58 cases, which is 11%. So mataas din, or yes, ng probability ng isang tao na nag-iisip na mag-commit or mag-attempt ng suicide ay may pinagdadaanan talaga. So anong ibig sabihin nito para sa atin? Ibig sabihin na hindi lahat ng mga gustong mag-suicide ay dahil curiosity lang. Dahil mayroon silang pangangailangan. Mayroon silang pinagdadaanan. Maybe because of mental illness. Another thing that we need to look at, kung meron silang pinagdadaanan o kaya mental illness, ano yung pinaka-rason? Ang isa ay makikita po natin dyan, again, may undisclosed dahil sa data privacy or dahil din sa hindi agad mabigyan ng diagnosis, lalo na pag namatay, of course, and yung time constraints. Pero kung titignan natin, top 1 dyan ang susunod ay yung depression. So it supports the evidences or researches and reports from the different agencies as well, even in the national government and the World Health Organization, that one of the major causes ng mental or ng suicide is because of depression. Okay? Ano naman yung mga naging or disposition or status ng mga cases na ito after their admission? So nakita natin na mayroong mga na-discharge and also may mga namatay. So kung ibig sabihin discharge na hospital yung mga ito. And most cases sa BGH na naitakbo doon ng mas maaga, nabuhay po sila. Ilan lang. Yung sa report nung last year, 4 lang. No? Pero most yung yung immediate intervention na na-hospital sila ay nabuhay. Okay? Yan. Tignan po natin yung data when it comes to ano ba ang nangyari sa mga ito. Yung mga attempted, ibig sabihin, nabuhay po sila. Salamat naman kay Lord at nabuhay sila. Pero hindi natin sinasabi na pag attempted, okay na sila, hindi. Kailangan nating i-follow up. And even the family, the members of the family ay kailangan nating bigyan ng intervention, kausapin. And even this time, would like to appreciate yung mga partners natin. Hindi kaya ito ni Department of Health sa Cordillera Region, Regional Office. We would like to, at this moment, to appreciate our health partners from the local government units sa probinsya at sa munisipyo. Ganon din yung mga ambag at tulong ng mga civil service organizations, mga volunteers, na kayo po ang tumulong lalo na nung pandemic. Ang daming nag-volunteer, ang daming mga organizations ang nag-rise upang sa ganon ay bigyan ng tulong yung mga hindi na gagampanan or hindi maibigay ng gobyerno. Kaya napakaganda itong ugnayan natin na ito, and thank you sa pagdalo sa atin ngayong Dagyaw. Sa completed naman, meron po tayong 186, so 2019 to 2023, and of course, undisclosed. Ibig sabihin, hindi natin, ayaw nilang sabihin kung yan ay attempted or completed. So napakataas yung completed, kahit na sabihin natin mas mababa sa attempted. Ibig sabihin, sila ay wala na, pumanaw na. Okay. Ang mga source of data natin, of course, dito sa Baguio City Health Office, kung saan nandun din ang ating mahal na panauhin ngayon, si Sir Ricky. And sa mga kapulisan, sa BGHMC and other hospitals, Abra Rural Health Unit or Abra Provincial Health Units, mga munisipyo natin from the provinces, and sa ating mga probinsya. Now, gusto kong i-promote ito sa atin, sino yung pwede nating mga tawagan kung mayroon tayong mga pinagdadaanan o kaya may mga kakilala kayo, may gustong kausapin. Meron tayong mga helplines na available. Although ito ay based from our data, kakaunti pa rin ang tumatawag sa atin. Okay? Dahil maybe hindi nila alam, maybe hindi okay sa kanila yon. Hindi din natin alam kung ano yung mga rason. Pero gusto nating ipaalam na meron tayong mga available na helplines. Nandyan ang sa atin sa HD car, meron din doon sa City Health Office, sa BMHA, sa BGHMC, and of course sa DepEd, meron sila dyan. Now, ano yung mga ginagawa ng gobyerno upang sa ganun ay mabigyan ng intervention yung mga ito? Meron po tayo doon po sa Department of Health, sa Regional Office, ang ginagawa natin, hindi talaga natin kaya na ibigay lahat. Kaya kinakapacitate natin, unang-una, we capacitate our health partners from the different local government units from the provinces to municipalities through the provision of trainings, mental health and psychosocial support trainings, PFAs, together with our partners, resource persons from the different, ito napakaganda, yung mga civil service organizations natin, PMHA, and sa ating mga volunteers din, para makapacitate yung ating mga local government units. Another one na ginagawa natin sa Department of Health is to institutionalize itong mental health program sa mga local government units natin. Partner natin dyan ang DILG with yung crafting ng kanilang ordinance upang sa ganun ay bigyan nila ng pondo yung kanilang mga programa sa kalusugan sa pag-iisip. Okay? And of course, mabuo din ang mga council o kaya health boards. Dito sa Baguio, ito ang pinakauna na nagkaroon ng Mental Health Council. So palakpakan natin ang Baguio City. Yan. At dahil nabuo ang council, na-recognize yung efforts at kakayanan ng bawat isa. Hindi lang po sa gobyerno, kahit din po sa mga private citizens. And aktibo po ang Baguio City when it comes to the intervention ng suicide or yung mga cases natin related to mental health. Ang susunod natin dyan ay ang mga probinsya ngayon. We are also ongoing din sa Mountain Province, sa Kalinga, sa Abra, and sa Benguet. Okay. Next natin yung other provinces. Another programs that we are having or providing from the Department of Health, ito ang isang concern talaga natin, yung pagbibigay ng mga gamot pagbibigay ng mga gamot kasi mahal ang gamot. Yeah, mahal ang gamot talaga pag sa mental health illness. Subalit ang maganda naman ay at least mayroong binibigay ang central office na kaunting tulong para sa atin. Augmented medicines na yun po yung binababa natin sa ating mga probinsya at mga munisipyo. Okay? And with the help ng mga capacitated municipal health officers natin, mga partners natin sa hospitals, trained na mag-diagnose ng mga mental illnesses, ina-advertise ko sa inyo at pinopromote ko na kung mayroon tayong mga kakilala na mayroong pinagdadaanan ay hikayatin natin sila na magpakonsulta sa pinakamalapit na municipal health offices, district health offices, sa city health office natin o kaya sa ating mga hospitals. Ang isa din na ginagawa natin, napakahalaga ito at ito meron po tayong magagawa kahit sa mga estudyante. Health promotion. Yung pag-promote natin ng mental wellness. At yung mga programa na ginagawa hindi lang sa gobyerno, kahit dito sa mga schools. Because under the law, we need to promote the mental wellness, mental health and wellness of the people sa ating mga school, sa ating community, sa ating mga workplace. Sa workplace, partner natin si Dole. And even this afternoon, we are going to have our meeting with the different regional agencies. At pag-usapan namin itong mental health din na ito. Kung ano yung pwede natin pang gawin at pwede natin maitulong sa ating mga kababayan. Dito sa university alone, kung tatanungin ko kayo, mga ading, mga kapwa estudyante, I've been here for 12 years bilang isang estudyante at isang empleyado din. Nakapagbisita na po ba kayo sa inyong guidance center? Yan. Nabisita yung guidance center yung? Haan, kunan dyan duma. Wun, kunan dyan duma. Amuyo, ayan na, guidance center natin dito sa UC. Ada jay HRM kunada. Ada jay baba. Yan. They are also our partners. The guidance offices sa high schools, sa mga elementary, sa colleges, different colleges, partner natin sila sa pag-promote ng mental health. And we would like to appreciate na sa UC, isa na binibida din nila ay ang mental health. And thank you so much for that one. Palakpakan natin ang UC. Advocacy din ng maraming mga kaibigan natin dito. And also, aside from that, na mga health service deliveries, gusto ko i-promote ito na ang mental health, gusto natin na mag-community base. Para sa ganun ay hindi lang doon sa taas natin nakikita, kahit sana doon sa mga barangay ay pwedeng i-avail. We will go there. Now, I'm not saying na marami tayong nagawa. Kulang talaga. Even in the Department of Health, we are acknowledging that kulang yung ating programa na ginagawa. At hindi kaya yan ng isang tao, isang ahensya. It is a collaborative effort and we acknowledge especially yung presence ng mga civil service organizations here helping us, okay, to promote and also to value yung mental health ng ating Cordillerans o fellow Cordillerans. So, yun po yung gusto kong iparating sa inyo. Mamaya, kung may mga tanong kayo, pwede nating pag-usapan pa yung mga ito. But again, it's a privilege to be here on behalf of our Director Rio L. Magpantay from the HD CAR. Thank you so much sa pag-imbita ninyo sa atin dito sa Dagyaw. Thank you.
Thank you very much, Sir Shamgar. We understand that the issue we are talking about right now, especially the presentation that Sir Shamgar has just presented, is really a very sensitive issue, and may we humbly ask that we keep an open mind and an open heart in discussing these issues, because these are issues that are really, if we become aware of it, then maybe we will also be aware on how to prevent it from happening or from recurring. Again, thank you very much, Sir Shamgar.
Thank you so much, sir.
I think it's also very important that the public should know that there is an agency whom they can run to especially kapag mga ganitong mental health related issues. At sinabi nga po ni Sir Shamgar kanina na nandyan po ang DOH para tulungan po tayo sa mga ganitong issues. He also recognized and acknowledged the fact na hindi kakayaning mag-isa ng DOH at kakailanganin din po niya ng tulong at lagi naman pong tumutulong ang mga different LGUs, civil society organizations, and even a lot of volunteers, which nakita po natin yan noong panahon ng pandemya. Again, maraming salamat, Sir Shamgar. And of course, to provide an additional context on what Sir Shamgar has just discussed, may we also call, of course, from the Philippine Mental Health Association Cordillera Chapter Incorporated, represented by Department Head Ms. Riza Alma M. Evasco. Magandang umaga po, Ma'am Riza.
Yes po, magandang umaga po sa ating lahat.
Ma'am, maaari po bang makahingi kami ng karagdagang konteksto as in relation to what Sir Shamgar has discussed?
Yes, sige po. Unang-una, the Philippine Mental Health Association is a non-government, non-stock, and a non-profit organization that is dedicated to the promotion of mental health, prevention of mental illness, the eradication of stigma, and encouragement of others to become mental health advocates. So, tayo po sa PMHA, ang goal po natin, bago po natin pag-usapan ng mental illness, why don't we talk about mental health muna? Okay? So, ang unang-una po, ang primary program ng PMHA is the preventive education. So, meron po tayong department for that. That is the Education, Advocacy, and Research Department. Dito po yung department na nagbibigay po ng education sa ating mga clients, sa mga constituents natin. Because we believe that preventive education is the most inexpensive and by far the most effective way of preventing mental illness. Okay? So, under our Education, Advocacy, and Research Department, we have different programs po for our youth. So, we have the Youth Life Enrichment Program. So, this is especially geared towards the youth. So, ano ang purpose natin dito sa program natin? This is to educate the youth to become mental health advocates, on how to take care of their mental health, ano pa, and to encourage them to become our allies in promoting mental health sa schools nila. So, under po the Youth Life Enrichment Program, we have the Link Club, or the Lakas Isipan ng Kabataan Club. This is a program for the students in high school. Okay. So, before the pandemic, we had 28 Link Club members na schools po dito sa Baguio and Benguet. So, meron po tayong mga year-long activities para sa mga high school students natin. For the college naman, we have the Progressive Youth Association on Mental Health, or the PM. This is the program for the university students naman. So before po, ang ating mga participants or ang ating mga members ay mga psychology students only. However, we extended po yung program natin to other courses. Okay? So, yung ILA po natin is natigil lang during the pandemic, and we have already put in place yung plan to revive po yung program natin for the youth. So, aside from other youth, we also have a program for our parents. So, we have the creative approach to parenting. Okay? Stressful po ang mag-parent. So we at PMHA are lending our help po to help our parents determine kung ano yung nararapat na approach para i-parent ang kanilang mga anak. Also, we have ito po yung bago pala sa PMHA, ito yung community-based mental health program or the CBMHP. So in 2019, we had a partnership with the local government unit of Latidad. Okay, so ang ginawa po natin dito is to train the barangay health workers, the community health workers to recognize the early signs of mental illness, to capacitate them to discuss, to lecture on mental health, and kung meron silang makita na constituents nila who are suffering from any form of mental condition, kanino sila lalapit? Ano yung referral pathways natin? Okay? So, for the past 2 years, we have been conducting the CBMHP at Itogon naman. This is in coordination, in partnership with Johnson's & Johnson's. So, aside from the health workers, we have also included yung SKs natin and the religious sectors. So, ang gusto po natin, paano po natin mailapit ang mental health sa komunidad? So that is to train yung mga community health workers natin. Tayo na po ang pupunta sa community. Okay? Kasi alam niyo yung mga community health workers natin, sila naman yung nakakaalam, nakakakilala doon sa mga constituents nila, no? Kasi sila yung pumupunta sa mga bahay-bahay. Okay? So, aside from CBMHP, we also conduct lecture forums or learning sessions on various topics about mental health. And we have brochures, orientations. We have social media postings, radio guestings to promote our advocacy on mental health. The other program of the Philippine Mental Health Association is the intervention naman. So kung kanina meron po tayong prevention, meron naman tayong intervention. So for those who already have or are suffering from any kind of mental concern, meron po tayong clinical, diagnostic, and intervention services sa PMHA. So under this service, we conduct psychological assessment sa iba't ibang cases. So for school placement, for court-related cases, doctors are referring to us to determine kung ano yung best intervention sa kanilang mga pasyente. We also do psychological assessment for employment or for promotion. Okay? So, aside from psychological assessment, we also have psychiatric consultation. So, we are lucky po sa PMHA at meron tayong visiting psychiatrist na pumupunta doon. We have currently two visiting psychiatrists. Aside from psychiatric consultation, we also have counseling services. So we have visiting counselors din po. And then, ito din po yung bago at PMHA, we have the family support group. Okay? Ang family support group po natin ay nakatuon sa mga caregivers ng mga families with mental health condition. So it's like caring for the carers, no? Because we recognize that caregiving is very stressful. Okay? Kung kayo po no napadas yu nga ag-aywan, iti family member nga adda iti mental health condition na, that is very stressful, ano? So we have this family support group po para sa mga nanay, sa mga tita, grandparents, siblings na may inaalagaan sa bahay na may mental health concerns. So, ang family support group, we provide them venues to relax, to learn, to share, okay? Just to relax, to debrief. Okay, so currently we are on our 10th session of the family support group. Yung budget po natin for this program is through the donations po of our partners. So thank you very much po sa inyo. Kaya tayo nagkakaroon ng mga ganitong programs. So basically, sir, yun po yung mga programs na in-offer ng Philippine Mental Health Association.
So thank you so much, Ma'am Riza. Nakita natin, no, napaka well-rounded actually. It's not just, tulad ng sabi natin, intervention. Kasi I understand minsan, pag psychologist or interventionist, yun lang mismo, ano? But moving forward from intervention, prevention din, and also caring for whoever is within the individual's environment, diba? Parang ganun. So thank you so much for supplementing also the results or the data from the DOH. Ano? And this is considering dahil yung mga availability ng resources na ito, syempre, medyo mahirap, ano? For everyone to get yung sinasabi natin na mental health for all, there's always a limitation in terms of resources, di ba?
Yes, thank you so much. Of course, but before we proceed, may we remind everyone to please continue sharing our live stream. This is a very, very significant, very relevant topic, and we want to reach as many audiences as possible. And my prize, syempre, yung ating lucky sharer. So please continue sharing, hindi lang po ng mga nandito ngayon sa venue, but also sa mga nanonood sa atin ngayon virtually, please do share our live stream. And partner, gusto ko lang i-emphasize yung nabanggit ni Ms. Riza kanina, na ang sabi niya kanina ay instead of just talking about mental illness, why don't we prioritize speaking about mental health? I think that's a very good na nasabi ni Ma'am Riza kanina. Again, thank you very much, Ma'am Riza.
Yeah, and I'd like to resound din, kasi minsan kapag sinabing mental health, iniisip ng tao agad you have to be mentally ill to be, to get the intervention. Pero hindi nga, no? Mental health is not only when you're sick or even when you have mental illness, hindi ibig sabihin na hindi ka magiging mentally well.
Correct. And that is why this is a very important venue so that we could eradicate that kind of stigma. Kanina din po, nabanggit ni Sir Shamgar na dun sa data na present niya kanina, majority ng mga nagko-commit ng suicide belong to the young adult age group as young as 14 years old. Kaya kung mapapansin mo, partner, karamihan po ng ating mga audience for this morning are students. It's really, really very timely, Doc PJ. And that is why, since this kind of issue greatly affects a considerable number of youth, we also have invited with us a representative from DepEdCar, Ma'am May Claire Jimenez, who will be sharing with us the interventions which the DepEd has put in place to address these concerns. Magandang umaga ulit, Ma'am.
Magandang umaga po, Sir PJ and Ma'am. Thank you very much for inviting us sa DepEdCar. So, nabanggit kasi ni Sir Shamgar regarding sa guidance center. Kaya tinanong niya sa inyo kanina, mga students, pumupunta ba tayo sa guidance center? Wala? So sa DepEdCar, may mga 39 guidance counselors in DepEdCar na nandun lang sa school. So yung mga tumutulong na lang sa amin, mga guidance designate for the interventions na pwedeng matutulungan ng school. Then sa guidance in counseling services, andyan kasi nakaka-integrate yung mental health. Dun sa counseling, yung sa mga iba't ibang services na naibibigay ng guidance counselors. So we are happy na napag-usapan ito. So we hope na talagang matutuloy rin yung salary standardization ng guidance counselors sa DepEd para at least may mga patulong pa rin na advisor advocates doon sa DepEdCar. Kasi ang dami pong mga estudyante po sa atin na talagang need po natin na matulungan doon sa school. Yung nabanggit nga doon sa share ni Sir Shamgar, ang dami pa rin na hindi naintindihan ano ba talaga yung mental health. paano ba natin na mabibigyan ng tuon doon sa DepEd. So may mga naibigay doon sa programs ng DepEd ngayon, health and nutrition. Andun na po yung sa health and nutrition, naka-embed na po, under pa rin ng tulong pa rin ng Department of Health. And doon sa program din namin na intervention na isa, na ibanggit ni Ma'am Risa kanina, yung Philippine Mental Health Association, may MOA po sa DepEd Benguet. So, mayroon ang nangyayari po ngayon, sa kulang po namin sa DepEd CAR, sa mga schools, may mga interventions po or may mga partners po tayo na tumutulong na po sa DepEd. Kasi kulang nga ang mga guidance counselors doon sa DepEd CAR. So we have the Philippine Mental Health Association, sina Sir Shamgar and Sir Ricky. May mga concerns din na nangyari doon sa school. May mga referrals din kasing nangyari. Pero ang ano lang namin as profession, guidance counselor by profession kasi ako, we need to refer pa rin po sa mga cases na talagang hindi natin alam. So dun sa youth formation kasi ang isang inahandle po natin sa DepEd, may naka-embed na po yung sa mental health. And then andyan po yung project development officers na nagman dun sa parang may mga programs din sila sa SSG, student government organization, or dun sa learners na kasi ang tawag namin sa DepEd doon sa mga students or pupils, learners na po lahat. Meron po silang na-program doon na activities for the mental health, na integrate na po sa activities ng mga youth formation. Yun po. Tapos yun sa career guidance din po. Doon po kasi pumapasok yung intervention din namin na paano makatulong yung mental health. Parang pag-usapan nga natin ang mental health, pero nandun yung sa career guidance kasi, pag nagsasalita isang professional, pag naririnig ng mga estudyante or mga learners, yung paano siya naging successful, parang nagaano rin yung isipan ng mga kabataan na, ay, ganun pala siya. At least na bubuksan po yung isipan natin na maganda pala yung buhay. Yung pinagdaanan pala ng isang tao is, yun pala yung buhay niya ngayon, pwede ko palang kayang pa rin na mabuhay. Na hindi ko na stop yung buhay ko, magbasa ako ng mga mental health, advocacy, mga programs na pwede kong i-share sa ibang kabataan. So yun po yung isa kasi na gusto natin ng ipahatid sa mga estudyante, intervention and prevention. Then lagi nating sinasabi din sa mga teachers, referral pa rin. Kung may mga naiisip din, pumapasok din kami sa parenting actually. Yung sa parenting, at tinuro din ng Philippine Mental Health Association sa mga teachers, pumapasok na rin sa community base. For example, may mga teachers silang ini-invite sa community, doon pumapasok yung parenting. Kasi ang isa natin na tinitignan din kasi is yung relationship ng parent at saka mga bata. Yun kasi ang isang gusto din natin na hindi mangyari. Yung parang hindi siya napapansin sa bahay, may mga problema siya na isi-share sa ibang tao, hindi sa family. Kaya yung support group talaga doon sa bahay at saka sa school. Ang isa pa nating iniisip ngayon, for example na may mga talagang nag-iisip na mag-suicide, i-break po natin yung confidentiality. No? Mga students, pag may mga kilala kayo na talagang gustong may iniisip na iba, pakisabi na sa family nila para mabantayan naman. Kasi kung hindi natin i-share kasi ito, parang sa atin lang, hindi mo i-share ito kasi na matatakot ako sa bahay, baka may sasabihin, gusto ko kasing magpakamatay or gusto kong may gagawin sa buhay ko na ganito. Kailangan po natin yung sharing doon sa nangyaring yon, tapos i-share din natin. Kasi hindi po talaga biro po ang depression and anxiety. Nandun kasi na sa isipan nila may times kasi na parang may nagbubulong sa kanila, doon na talaga yung need na talaga. Kung nag-share sila sa inyo na mabigat ang problema nila, pakinggan ninyo. Din i-refer po natin sa mga adult, sa parents, sa mga spiritual leaders natin. Yun po ang magandang tulong po natin sa mga ganyan po nag-suicide attempt. No? Then, sa family din po, yung tulong din ng family, hindi po rin kaya ng teachers yung problema sa school. So, yung sa parents, mga guardians, yun po yung need po natin sa school, na kung merong may mga meeting sa school, kasi doon nag-uumpisa yung hindi napapansin ng magulang, parang na-isolate na yung bata. Ang need kasi nila is yung support talaga ng magulang doon sa eskwelahan. Lagi po nating sinasabi na sana kung magulang din tayo, mga students, pag may future na tayong gusto nating magka-family, talagang ang alagaan po natin, mga anak po natin. No? Habang bata po tayo, gusto ba dating mag-family? Gusto ba natin na yung magandang family is mababantayan natin sa schools? Wag lang nating pababayaan. Sa mga parents po, need po natin yung support sa schools kasi hindi po natin kaya ng mga teachers po natin na andun lang sila kasi sa curriculum, pagpapasok po nila sa school, pagtuturo po, and yung gabay pa rin ninyo na parents na nandun pa natutulong sa school. So yun yung mga parang gusto rin namin na ipahatid sa mga parents na hindi kaya ng DepEd lahat po doon. Kaya sa may intervention, prevention po, yun po natin na gustong ipamahagi dito sa audience po natin. Then yung sa youth formation, kung may mga activities din natin na may sharing po yung mga youth formation na activities for the students. Andyan yung SK na nabanggit ni ma'am kanina. Kaya sabi nga namin, rini-recommend din namin kasi kulang ang budget po ng DepEd sa activities ng mga students. So we recommend din sa National Youth Commission, NYC, noong isang meeting po namin na sana yung SK is tutulong pa rin sa activities. Kasi yung activities kasi ng youth, wala siyang budget, kulang siya yung budget. Kaya at least mapag-usapan naman lang yung activities for mental health. At saka ang gusto nga natin ngayon is convergence, hindi lang mag-isang tao. Yung nga, laging binabanggit na ang guidance counselors, kulang. So convergence na lang kung sino po yung mga tutulong sana na agency, private agency, kasi lahat po tayo is concerned about mental health. Yun po.
Thank you, Ma'am May Claire.
Palakpakan naman po natin si Ma'am May Claire. Super,
Yes.
narinig natin yung the need for collaboration. Kumbaga.
That's right, partner. And we would like to emphasize 3 significant points which Ma'am May Claire has just discussed. Una po, kulang po talaga tayo sa mga guidance counselors and we are recognizing their significant role in these kinds of issues. At maraming mga estudyante ngayon, so baka naman gusto nyo mag-endeavor then on becoming a guidance counselor and help more Filipinos. And second na nabanggit po ni Ma'am is I think yung stigma na kapag ang estudyante ay napunta sa isang guidance counselor, that student is already causing trouble, no?
Yeah, hindi naman di ba? Hindi nyo kalaban ang guidance counselor. They're not there to discipline us, di ba? Parang gano'n. Kasi usual connotation yan, di ba?
Tama yan, partner. Kaya sana tanggalin din natin yung stigma na yon. And number 3 po na nasabi ni Ma'am, lalo na po ngayon sa mga nanonood ng mga parents, ito po isang panawagan that we also help the Department of Education in listening to our children. Let's talk to them, gabayan po natin sila at pakiramdaman po natin kung meron na pong hindi po maganda na ini-exhibit ng ating mga anak. So again, Ma'am May Claire, thank you very much for sharing that.
Thank you so much.
And partner, kanina kasi, when we started, nabanggit natin that this Dagyaw seeks to solicit feedback from the public with regards to government programs, policies, and activities. And we also emphasize the impact of citizen participation in shaping these policies and setting development goals. Kaya
That's right, partner. Kaya nakita natin, hindi lang naman ang government ang gumagawa ng efforts dito. But actually, it's a collaboration between and among a lot of agencies, whether private or government na. So, to have feedback or to gain feedback from our civil society organizations, to provide their insights and also comments about what we have been talking about in terms of mental health. We have one of our CSO reactors with us on stage, Sir Ricky B. Ducas Jr. from the Anxiety and Depression Support Group Baguio. Ayan, ang ating celebrity nga daw.
Hi! Good morning and thank you again, Dagyaw DILG, for our second year. Yeah, and I hope this is a safe space and safe avenue for you. Katulad kong kabataan, may agrama. tulad nating kabataan to air out or ventilate everything that you would like to ask. And we have here the key persons, the right people to answer your queries. Yes, I'm from Anxiety and Depression Support Group. And we have this framework that we're currently using right now, which is the health promotion, disease prevention, the curative aspect, rehabilitative aspect. As my colleagues here mentioned earlier, that we are more on promotion aspect of mental health or promotion of health, no, when it comes to mental health. Now, summing up all those things, in Anxiety Depression Support Group, we started as a young professionals, and we branched now. We have the Anxiety and Depression Youth already. Yes, so that's the new group of the Anxiety and Depression. And we encourage them to join us in legislation making. So there are a lot of students coming from UC, actually, who is a member of Anxiety and Depression Support Group. And yearly, we have this legislators summit wherein you are allowed to create and draft an ordinances, and it can be adopted by the National Youth Development Council or the local Youth Development Council. And it can be funded by the DOH together with us, DOH, and other line agencies. So, happily that we garnered all the first ordinances, and mga estudyante ang gumawa. Gumabay lang po tayo. So that's one of our promotional activity. Then we have the Zero Suicide Campaign and the Mental Health Kabutihan. We have the booth there every Sunday sa Session Road, and all we're going to do is yung mga ginagawa po natin, pwede natin gawin bilang isang youth is more on linkages, di ba? So that's what we are giving emphasis. No, you link them to us, you link them to proper agencies so as we can help. Let me go back to what I mentioned earlier, asking the guidance and counseling. Yes, that's true. Let's remove the stigma, okay? Guidance and Counseling Office is not a disciplinary office. It is a safe space for you, for your emotions, and for you to seek for professional help because they know how to link you to the professional help. And if there's a curative aspect of it where you need a clinician, they can link you and we can help you and everything will be free. Okay? Yun po ang importante. Kaya minsan it would be a hindrance sa atin to go there because inisip natin, hala, paano na? See? So we're creating anxiety at that part, no? Next is the employment opportunities of the caregivers. Diba? Because, or even people who are having this mental health condition or taking medication, they need to work and they need to go back. So we are having some programs with regards to this matter. And I'm so happy that the ILG is so friendly sa mga deaf and mute community natin. Because I can see there is someone, ma'am, I appreciate what you're doing right now. And the Anxiety and Depression Support Group is training more people who can do sign language on how to conduct psychosocial processing for these individuals. Because we cannot, unless we are, that's the reason why in mental health is one shoe doesn't fit all. So they know much better. So yeah, I'm so happy that we have here very friendly interaction together with our deaf and mute community as well. Next is the Mental Health Playbook, which is the DOH program. We are engaging the youth because youth can be deployed sooner or later to different health centers as peer counselors and will be funded by the DOH. So all the trainings, capacity trainings will be provided by the DOH, and that is under the category 5 of the playbook. So that's how it is worked. So basically, an Anxiety and Depression Support Group is linking you to all government programs which are existing already. We just need to capacitate you guys, inform on how to do it. So as you can enjoy, if you have to enjoy the benefit, and it's your right to know. And of course, I appreciate also the effort of different organizations right now because we are involved in the race for suicide training in schools and in workplace. And this is one of our campaign right now. Ako pong founder po ng Anxiety Depression Support Group. Pero ako din po ang Mental Health Program Coordinator ng Local Government of Baguio. I'd just like to give you an idea on what I'm doing. Actually, hanggang morgue, pumupunta po ako. sa lahat po ng mga death due to suicide, pinupuntahan ko po yan hanggang morgue. And I have to see, kasi kailangan namin yung death certificate and everything, no? Para mas maganda yung database soon natin. So hanggang doon, pinupuntahan ko. And there's a mixed emotion when going there. Now, one thing that na-realize ko, why not let's involve yung mga landlords na kung saan nag-rent yung mga students natin na maging foster parent nila, hindi lang taga-singil ng renta. So, that is one of our advocacy right now, to knock on the doors of those who are, renting out spaces, because a lot of students, all of these demographic presented earlier by DOH and everything is nasa teenage. So, we're doing this advocacy campaign, we're having the speaker campaign, I'm a foster mother, I'm a foster father campaign to those who are leasing out para sa mga students natin. Diba? So, it would be a friendly for everyone. Para at least pwede silang lapitan. If you have these needs. And lastly, under the mental health, napapabayaan po natin that we are having this advocacy kung saan we're trying them to understand that is also a neurologic disorder. Under these are neurologic disorders, wherein senior citizens have to be also catered when it comes to mental health. It should be all holistic. We have to address it, PMESS, as I said, physical, mental, emotional, social, and spiritual aspect of that particular person. And senior citizens also have that also aspect in their life. And isa yun sa mga ginagawa po natin. And lastly, Happy Pride, Gender and Development Office. So we need the Gender and Development Office to every schools. So we have to now open every opportunities, to be more gender sensitive, culturally sensitive approach on mental health. And lastly, this is the promotion of our office, anti-sexual abuse. Kasi nakikita po natin ngayon na as young as they are sexually abused. Kapag na-reach na kasi nila yung puberty, doon na nila nakikita na yung halaga nila bilang babae, bilang lalaki, the perpetrators is within the perimeter of home, and yun naka-apekto ng mental health nila. And we have to address this issue. This is a present issue. Kaya nananawagan po ako na this sexual abuse, physical abuse, which is happening at home, this is the safe space. We have a safe space where you can ask for help. Thank you.
Thank you so much, Sir Ricky. So nakita natin talaga, we're really rounding out all of the interventions and available services sa city natin or from different agencies. At gusto ko yung point na, ikaw ba partner, taga dito ka talaga sa Baguio?
Actually, taga-Kaliga ako.
Oh, ayun. So, di ba, it's true na, yung mga nagiging klase natin minsan or nakaka-interact natin, they live in boarding houses sa Baguio, di ba? At hindi nga naman, malayo nga naman ang support that they can get from their families. Kaya, that's a very good point, I think, yung fostering and capacitating anyone within the environment. Yun. So, now, at this point, syempre nagkaroon tayo ng reaction from our CSOs. We also have our various sectors who will also give their input to what our discussion was this morning. So for our first reactor, may I call on Ms. Ilona Bayod of Baguio Benguet Psychological Services and Consultancy Center.
Ayan.
So nandito po siya sa ating audience.
Good afternoon. Good morning.
We also have Mr. Lance B. Layugan of the Pansigudan Advocacy Cooperative.
Morning. Thank you for having us here.
And also Ms. Kimberly Dayan Mejia of Youth on Point. Dito po ba siya? Ayan. So they will be giving their reactions to the discussion. So una po muna si Sir Lance. Ayan. Ayan. Good morning po, sir.
Yes, good morning once again to everyone. Thank you for having us here. Maganda yung discussion natin, no? Maraming lumabas. And I would like to, first of all, focus on, kasi yung lumalabas na issue dito or gap is on awareness, mental health literacy. And although awareness, yung pinag-uusapan natin, I believe a bigger problem here would be understanding. Kasi pag sinabi nating awareness, pwedeng, alam mo ba ang mental health? Yun na yun. That's awareness. Pero pag tinanong natin, ano ang pagkakaintindi mo ng mental health, lalabas yung understanding talaga ng mga tao dyan. And there are two parts when we are talking about awareness and understanding. Awareness and understanding of the stakeholders, kayo po iyon, students, the family, parents, the community, and the awareness and understanding of our practitioners, so your service providers. Yung sa part ng students, awareness and understanding regarding services, ano yung serbisyo ng gobyerno, and mabuti naman at na-discuss ng DOH, DepEd, and also PMHA, yung services offered by them. Although there may be some concerns regarding the accessibility. Kasi nakita natin sa data presented by DOH a while ago, suicide cases, mataas siya in Dagyaw, Benguet, and Mountain Province. Now we know that yung number na yon, it may be because the services in Dagyaw and Benguet mas mataas siya or mas maraming service providers. Which is why it's also good na lumalabas itong numbers na to. Nakikita din natin yung epekto ng number of service providers in a particular community. But the question now is, how about the more remote communities? Bakit mas mababa ang reported cases ni Abra, Apayao, Kalinga? Possibly because the service providers are only limited in urban areas rather, sa city, Benguet, Baguio, at wala masyadong awareness or information campaigns on the rural areas. On the part of the service providers, mapapansin natin yung discussion kanina on the services for mental health. These are quite limited only to mental health. Although na-mention natin the involvement of the family, some barangay health workers, pwede pa natin ma-improve ito to incorporate other sectors of the society. Maganda yung multi-sectoral approach sana natin sa mental health, not just focusing on one particular stakeholder, pero i-involve natin yung other sectors of the community. And it's good, involves the family. That's one way of starting the multi-sectoral approach for mental health. On the understanding also of our service providers, when we provide services for mental health, sana hindi lang tayo nakatutok doon sa lens na yun, no? Kasi minsan, mental health concerns issues are not simply limited to mental disorders or illnesses. Minsan may mas malalim pa na cause yan. Mentioned a while ago, gender-based violence, issues on, what other issues? Issues in society, the use of harmful pesticides, pwedeng ma-consider din natin yan kasi yung second topmost way or method of people dying by suicide kanina presented a while ago is substance ingestion. So bakit ganun yung lumalabas na data? So these are some of the things that we may look into, no? On the provision, accessibility of services, we look into other than just the urban areas, capacity building for our community-based providers, although na-mention din yan ni DOH kanina, capacitating barangay health workers, para manggaling talaga sa kanila, or at least from the barangay level, there is psychological first aid. May paunang lunas ng nabibigay bago pa siya, o bago pa tumaas yung level ng concern. Towards that end, again, we try to involve more people, not just barangay health workers, but possibly also CSOs. Kasi sila naman yung nasa community, sila yung mas makakatulong sa atin. Other possible programs by the government, siguro funding, kasi nasa gobyerno ang resources. And so more often than not, the capability, the expertise, it is with the CSOs. So the partnership between government and CSOs, that's good. So that CSOs magbibigay ng services, funding lang si government. In the part of schools, pwedeng tumulong din si government, again, funding of mental health professionals. Just recently, doon sa proposed ordinance ni La Trinidad, they are looking into funding guidance counselors to be assigned at different schools. Kasi alam natin, limited talaga yung guidance counselors natin. Although on that end, baka hindi lang guidance counselors yung pwede nating i-fund, but other psychology professionals, like psychologists, psychometricians. Kasi pwede rin naman silang magbigay ng services, not just guidance counselors. And also, regarding the academic setting, we can, perhaps the government can also provide scholarship support for our students pursuing these professions para maengganyo silang ipagpatuloy yung tapusin yung degree nila at ituloy-tuloy kumuha ng lisensya para mas makatulong sila sa community. I think for now, that's all.
Thank you so much, Sir Lance. Let's give him a round of applause. Ayan. So tuloy-tuloy po natin ang reactions natin. So let's go now to Ma'am Ilona to give her own reaction to the discussion this morning.
Ayan. Good morning, everyone. Alright. Ang ganda nung present nung ating panel with regard to the mental health activities. Indeed, we have an unseen enemy here. Okay? Marami na rin tayong cases ng suicide, as reported. Paano pa yung hindi reported? Paano pa yung mga cases na ayaw pag-usapan ng pamilya and they do not want to report? And we understand, but then again, meron tayong kailangang ayusin. But first and foremost, to talk about mental literacy, banking on the stigma, we have to understand that if a person goes to a mental health provider, ang lagi kasing iniisip nila, may mali sa akin. No. That's actually one way of seeking for help. Okay? Pupunta ka doon because you need help, hindi para makita kung may mali sa'yo. Okay? Kasi that's also one way that's stopping a lot of adolescents or youth to engage in mental health services kasi baka may makita sila sa akin. Natatakot sila. So please do not think about that on the line of that thought na may mali sa'yo. There's something going on, and hope is actually being offered and a help sa mga mental health providers. Okay? This is also multidisciplinary. Ako, we support the activities, anything related to mental health. Whether you have a background in psychology or not, iisa lang ang goal natin, to help our community. Alright? So, we actually encourage a lot of volunteers. At the end of the day, it is your heart to serve. Yung puso mo na tumulong. So, definitely, with certain policies and all, minsan nga, kapag in cases of emergency, hahanap ka pa ba talaga ng may lisensya? If there's someone who is really available and somehow well-trained, may background in helping a person who is in distress. You get my point? Alright? So, we do encourage and support itong mga activities provided by our volunteers, the NGOs, DOH, definitely, PMHA, and other na mga activities. Alright? Siguro with regards sa mga parents, in most cases that I have handled with Bausi, when I ask them, kapag bakit hindi sila nagsabi kaagad, because there've been a lot of cases that they have been abused, since bata pa sila, nalaman na lang after 10 years, after 15 years, after 8 years. One reason is that baka mapagalitan ako, That's one reason. Ayaw magsumbong sa mga magulang. So siguro, maganda yung activity ng PMHA, no, dealing also with parenting because ang hirap maging magulang sa panahon ngayon, no? Napakahirap, okay? So, we also have to really, make our parents or even our guardians, no, caretakers, caregivers ng mga batang ito, na maging safe yung presence din nila sa mga bata, that if something is going on at nakikita na nila, why don't you call on the child? Let's talk about it, no? Hindi ako magagalit. Ano ba yun? Kasi common yun. When I ask these victims, number one, ba't hindi nagsabi agad? Number one is, takot po akong mapagalitan ng magulang ko, no? So, that's one thing, no? And then, siguro po, no, since andito na rin po ang DepEd, no, I've handled cases wherein may mga activities po kasi. For example, talk about family. Not all may ganung traditional family. No, you draw your family. Kasi there's a case na yung bata ayaw nang pumasok sa school because of a certain activity na magdo-drawing ng family and all. And then the teacher, kasi ang drawing niya, siya at yung lola niya. No? So the lola is the one who really took care of him. No? And then sabi daw nung teacher is, asan yung nanay, tatay, ba dapat pag family? Like, come on. We do away with the traditional notion of family. No? Kapag nakalagay sa isip nila, broken family kasi ako. Once I hear that, alright, sino nagpalaki sa'yo? Sinong kasama mo? Ako po, tapos yung tita ko. Saan si mami? Iniwan po ako nung bata pa ako. Kung ganyan, no? Asan si daddy? May iba na pong family. Okay, sinong kasama mo ulit? Ako po, tita at lola. Then that is a family. That is a family. No? We remove in their mind, broken family kasi ako. Wala kasi akong nanay. Wala kasi akong tatay. And it gives a negative connotation. No? It affects their self-esteem. No? So, pag nakikita nila sa community, no, na ang family ay hindi lang yung may nanay, may tatay, no? Nakikita, this is a safe space community. No? I am accepted here even if I don't have my father, even if I don't have my mother. No? Kaya pag may mga kaibigan tayo, naririnig yun, sasabihin, broken family kasi ako. Nothing is broken there. You and your lola, that is a family. You and your tita, that is a family. You and your magkakapatid, may ganun no? Na yung eldest nilang kuya, siya na yung tumayo, no? Na magulang ng mga kapatid niya, then that is a family. Okay? So that's one thing I'd like to emphasize. Okay? Yung sabi po ni ma'am kanina, yung breach of confidentiality also, that's very true. No? Minsan may magsasabi, pagod na ako, gusto ko nang mamatay. You inform the right person. Huwag po nating imarites, no? Kasi ang mangyayari, nabibreach yung confidentiality, pero chinichismis, maling tao. So eventually, hindi tayo nagiging helpful, no, doon sa person. In cases of ganitong suicidal ideations and all, mas okay nang maging OA kesa maging huli ang lahat. No? Yung sasabihin mo, OA mo naman, di ba? Tara na, no? Shot kit di. O, di ba? Dagita kastangay, nga ibaga tayo. But a lot of people would only use humor because they don't know how to handle, no, yung mga ganong situations. Dinadaan natin sa tawa, dinadaan natin sa joke. Dita lang, di problema, shot kit di. O, tapos nawawala na, no? Hindi na napag-uusapan. So, kapag may mga ganun tayong kaibigan, no? O sige, come on, let's talk about it, no? Inyati mabaling nga maitulong ko. Saan ba kita pwedeng matulungan? If you know that you are not capable, halimbawa meron siyang concern or issue na nasabi, no? If you know that you cannot handle it, you refer, gusto mo samahan kita, no? Meron nung pinost kanina ni Sir Shamgar, no, from DOH, yung mga hotlines, tara, tawagan natin. And then stay with that friend, no? Sige na, tawagan natin, magpa-appointment tayo. Okay? So, at least, no, in that way, yung presence mo, you are saving a life. No? You're saving a life. Okay? Yes, na-mention kanina yung mga landlords. I like it, no? Kasi Baguio ang pinakamataas. But syempre ang mga estudyante dito nanggagaling din sa ibang lugar. I've heard of a dormitory na monitored ang pag-uwi ng bata. Like, pag umuwi ang isang bata, like, halimbawa from school, no? Pag umuwi yung bata ng 7 p.m., may automatic na message na napupunta sa nanay, sa parents na nakauwi na yung kanyang anak. Okay, so that's also a good way, no? Of course, hindi naman lahat ng dormitories ay high-end na, no, yung mga technology. Pero tama yung sabi ni Sir kanina na magandang yung mga landlords, magkaroon din sila, no, nung thought na ako ang nanay ng mga batang ito dito sa Baguio. Okay? Yesterday I was talking with a mother, no, na isa sa mga nagiging common na cause din, no, ng depression ng mga students, lalo na sa mga first years, yung homesick. No? So, yung mother, no, yung daughter niya is enrolled here in Baguio City. Tapos, magme-message daw yung anak niya, Mama, nalulungkot ako. Tapos yung emoticon na talagang umiiyak. No? So, sa kanya din, as a mom, gusto niya ng umakyat ng Baguio, no? Kunin na lang yung anak niya at ibalik na lang dun sa province. But then, yun nga, gusto rin naman nung daughter niya na dito talaga makapagtapos ng pag-aaral. So, sabi niya, no, what she did, kahit nasa office siya, inopen lang niya yung video cam for 2 hours. No? For 2 hours, yung daughter niya nasa boarding house dito sa Baguio and then siya naman nasa province. So, ganun lang. No? Siguro we encourage, no? Kapag may mga ganung cases, magandang we take advantage of the technology. Why not? No, just to feel again the presence, no, of the significant family members sa buhay natin. Okay? And then, of course, no, with government, talagang yun naman, no, resources, funding, no, if we can have like talagang international funding or international donations, okay, magagawan ng paraan. That's why maganda na ang school nagkaroon din ng movement. Hindi na prefect of discipline. Dati naman kasi, ang prefect of discipline, guidance counselor din, diba? So, Lance and I were talking a while ago, takot ma-call a parent. Diba? Ano bang initial reaction? O call up, guidance office. Anong initial reaction ng mga magulang? Ay, naramid mo. Diba? Apay, bakit ako pinapatawag? Immediately ganun eh. Na sana pag guidance office, uy, I have to take a leave from work. No? I think my daughter, my child needs me. Dapat ganun yung perception. No? Hindi yung pag-guidance ang nagpa-call a parent, may maling nagawa ang bata. Okay? So, magandang move yun. Iba ang guidance center, iba ang prefect of discipline. No? So that hindi na-associate ang guidance counselors or school psychologists na sila yung nagdidiscipline sa mga bata. Alright? So those are the salient points. No? Just I'd like to share. Thank you.
Thank you so much, Manilona, for putting emphasis on those points. Now we have our reactor, Miss Kimberly Dayan Mejia.
So, hello po, good morning everyone. So, in behalf of Miss Frances Lampas, I will be speaking for the Youth on Point. So, So right now, I just want also to thank the speakers. So for your plans, for the interventions that you have laid out for us. So truly, we have to speak about mental health first before speaking about mental illness, just as what Ma'am had said to us, and also from Ma'am from our DepEd, you also have talked about the collaboration. Actually, from the Youth on Point, Youth on Point was born 2 years ago. So with the following goals. Our first goal actually is for the mental health awareness. So that's our first goal. Then the second is the leadership for the next generation. Number three is volunteerism. And number 4 is to provide the community or a safe place for our youth. So right now, we just have concluded our 10 weeks po. So we have been with Pine City National High School for the past 10 weeks. So we have been speaking about dimensions of wellness or wholesomeness. So right now, it is very timely because we are also speaking about mental health. But we have to admit that when we speak about mental health, it is not just about mental health. Right? There are also many aspects of us as a human being that we need to address to. And mental health is just one aspect. So in the Youth on Point for the past 10 weeks, every week we are speaking about a specific aspect. For example, for week 1, we're speaking about relational. So we started about the family, because family would always still be the basic unit of society. So from our youth, the family would still be the support of our youth. So kahit naman anong mangyari yan, na unang tatawagin pa rin ng bawat isa sa atin, si mama or si papa, whatever age we are. Then for the week 2, we have speak about relational. So the importance of the friends and the community. So there are also kasi na they are orphans, ganyan. So they have community or they have friends that they also have treated as their family. So from this, we have enumerated the advantages and disadvantages of good and bad influence through friendships and associations. And of course, the week 3 is the spiritual. So sometimes spiritual is something na ay masyadong spiritual, masyadong religious, but being spiritual is not about being religious. And spiritual is something that we also have to talk about and tackle when we speak about mental health. Okay, yun. So, in the spiritual, since the Youth on Point was born from our church, the Light of the World Worldwide Ministries, under the leadership of Dr. Arnold Santonia. So in our church, we also cater different small groups, cell groups, kasi diba, there are youth that they're not comfortable in speaking to people that they do not know. So in church, we provide cell groups, ganyan, so that they would have a support group or a small group that they can trust, so that they can speak on to. The week 4 is talking about emotional. Yan, emotional because sometimes emotional is also also an aspect that they have to cater because there are a lot of people na they do not know their emotions. Sometimes they do not know that it is only, what is the difference between a depressed mood versus depression. Yan. Kasi diba, depressed ako, ganyan. Ganyan sila usually. No? As a previous resident doctor po, lagi silang ganun na depressed mood, but actually they do not know what really depression is about. So, from the emotional, we tackle about the range of vocabulary naming feelings. So, what are really feelings and what are emotions? And week 5, that is where mental health concern is pumapasok na po siya at week 5. So, here we also define mental health. And that's very nice to hear po from our speakers na really mental health first before the mental illness. And then the physical, kasi physical would also have variations in our emotions and our mental health. Kasi aminan man natin, our hormones will also play a role in our mental health. For example, for a youth na laging nagsistay sleep at night, gabing-gabi natutulog, yan, malaking influence po yan sa kanilang emotions. And usually, they become unproductive during the day. Yan, doon na minsan nagkakaroon ng, pag naging unproductive, nagiging idle yung mind nila, tapos natutulog lang sila during the day. And kapag naging idol sila, ayan na, lalabas na yung different emotions na, bakit ganun? I feel sad. Ganyan sila. And then next would be the sexual. So sexuality is something na minsan parang may stigma din actually when it comes to sexuality. Especially those who are sexually abused. On the WCPU, I catered patients na 10 years na doon pa lang sila nagkaroon ng courage to speak about their sexual history. So this is also something that we tackle on YOP. The next is intellectual. Yan, sa intellectual, the importance of decision making. So intellectual kasi, we do not expect a youth or during these ages to think maturely. So in the physical talaga, biologically speaking and anatomically speaking, yung frontal lobe natin, siya po talaga yung huling nade-develop. So we would expect na they won't really develop maturity at a very young age. So it is also tackled here. And then next is financial. Ayan. Also financial is one aspect na we also tackle about because sometimes this brings stress to a lot of students. You know, when I was an intern sa CHD po, a lot of students there, every morning po kasi nag-duty po ako din sa may mga part kung saan meron silang annual or ano bang tawag doon? Those who are sexually, yung para sa mga STI, to prevent STI, for those teens na nagtatrabaho po sa mga bars, ganyan, sa mga club, usually every morning nagkakaroon po sila ng annual. So every morning swabbing, tas bibigyan sila ng pills, ganon. So the main reason, I asked them personally, kasi ako na-curious ako during that time. I asked them, one of the reasons is because of financial difficulties. So, siguro, one thing na aminin natin, it is also one of the things that we really need also to cater, ganyan. Gaya nga po nagsabi ni Sir, more scholarships, ganyan, more opportunities and avenues for students. And last would be the social or the digital. So, tayo po as mature, no, we have the responsibility to share what is necessary, what is true, what is accurate, because about the things that we share, kung tayo po is magiging ano tayo, parang you would be number one advocates of mental health, then of course, it will not be a stigma. Ayun. Sabi nga, di ba, mental illness, nagiging I siya, but then, mental illness is a we. Yun. It makes sabihin, it involves every one of us. So, lahat naman tayo may social media, ganyan. We can use it specifically. And here in YOP, we teach students to be an empowered communicator. Ayan. To communicate only what would help the society. So, these are the things that we have tackled from the previous YOP. And truly, sabi nga pa ni Ma'am, we need collaboration. So, we just have started from the Pine City National High School. And right now, ang nagiging track po namin is to develop more leaders and facilitators. So we have catered to 592 students. So from there, we have 50 interested joining na they will be empowered as well to teach and coach. So yun nga po, mapakaganda na magkaroon ng collaboration. It is multi-sectoral, sabi rin po ni Sir. Collaboration from our sectors. And we also need funds for this. Ayun po. So, yun po yung pwede nating magawa. And thank you because from this avenue, I have learned na grabe palang dami pong ginagawa ng ating government for this. Kasi po, when I was a resident at BGH, parang nakikita lang namin parang left and right, gano'n. Wala po akong ER duty na wala akong chemical ingestion or ganitong, mga ganong cases po. And ang nangyayari po kasi sa hospital is just, nandun lang po kami sa curative part. But prevention is always better than cure. Ayan. We have safety planning for adolescents. Yan, bago po sila umalis, meron pong hotline na pwede nilang tawagan. Actually, binibigay din po namin yung cellphone number ng page namin. Ganyan, binibigay po namin. Para in case na gusto nila mag-suicide, they can call on them. However, wala din pong tumatawag minsan. And pagdating sa amin, they are, yun na, nakainom na sila. Yan, nakainom na sila. Pero thank God because they're also being recovered. So right now, yun po yung advocate namin is more on prevention and more on advocacy and mental health po. Yun lang po. Thank you.
Thank you so much, Ma'am Kimberly. Now, at this point, dahil medyo narinig na natin, partner, from our panel, our reactors, and also from a lot of the people, our stakeholders, siguro time na para mabigay natin sa audience ang panahon para magtanong siguro.
Yes, partner, thank you. But just before we go to the next part of our program, this is just very, very quick. I-emphasize lang natin yung mga sinabi ng mga reactors natin. Again, thank you very much. From Sir Lance, he emphasized the significance of not only raising awareness, but also understanding. Because awareness and understanding should go hand in hand together. Ma'am Ilona emphasized yung significance of breaking the stigma of people who seek mental health services and as well, breaking yung traditional notion ng family. And of course, from Youth on Point, she also emphasized the significance of family, community, and spiritual life groups so that we could address these mental health-related issues. Okay, palakpakan po muna natin sila.
Napaka-multi-sectoral talaga ng ating discussion
That's
for the
correct, partner. And so, we are now opening the floor. We know that you have a lot of questions in mind. So what we're gonna do is that we actually have a microphone dyan sa part na yan sa may gitna. So whoever wants to raise their question, again, sabi nga ni Doc Ricky, this is a safe space for us to actually ask questions with regards to our issue for this episode. You may proceed doon sa microphone, but before you ask your question, please do introduce first yourself. For our viewers online, you may also ask a question by dropping your questions on the comment in our live stream. Okay, so I think we already have a question from our physical audience. Please introduce yourself.
Hello po. I'm Orville po. I just graduated BS Psychology sa SLU. So I'm representing my organization po, Kilos Ko Youth, youth arm ni former Senator Kiko Pangilinan. So marami pa akong questions. Nabanggit na po lahat kanina yung answers ng iba. Pero isa-isahin ko na rin po. First is, kumusta po ang programa ng mental health? Nakaka-reach ba ito sa mga far-flung areas? Effective ba ang pag-house-to-house ng mga barangay health workers natin? Meron bang tools? Indigenize ba ito or localize? How frequent po yung mga trainings para sa mga barangay health workers? For CSOs po, meron bang programa na dapat may volunteer care sa mga orgs and CSOs? Meron bang training for peer facilitation, focus group discussions, psychological first aid? Sa mga schools po, alam natin kanina nabanggit na yung mga estudyante ayaw magpunta sa mga guidance centers. So, may intervention po ba ang LGU like mga booths sa schools? Or pwede maglagay ang LGU ng mga malalaking posters sa lahat ng gates sa schools? Additionally din po, baka pwede maglagay din sa mga bars like alcohol is temporary, therapy is long-term, and then yung information ng mga hotlines. So, ayun lang po. Thank you po.
Yan, thank you so much. Napaka-jam-packed ng
Oo
mga
nga.
questions na.
Thank you. But maybe we focus first on the first question with regards to whether or not there are community-based mental health service providers. I think that was your question, first question. Ano po? And maybe we could ask who would like to answer from our panel members, Sir Shamgar?
Or you can shoot anywhere kasi medyo maraming questions. So maybe if it's related, you can already answer it.
Salamat po sa katanungan on the community-based regarding doon sa training ng mga barangay health workers. Ang ginagawa po natin is a series of trainings. So, hindi lang po isahan na pupunta tayo at magle-lecture sa community. So, ilang balikan po yung gagawin natin to make sure that they are capacitated, that they are educated about mental health, and to educate them on how to recognize the early signs of mental disorders kung ano ang gagawin nila kung may na-identify sila sa community. So far, on our 2 years of partnership with the local government unit of Itogon sa community mental health program natin, may mga referrals na po sa ating opisina na na-identify ng ating mga health workers na sa tingin nila ay nangangailangan ng professional help. So, based po sa aming experience, nakatulong po yung ating programa sa community. Yun po. Tapos, sir, doon po sa question po ninyo kung may umabot na ba yung mental health service sa ibang communities. So, sa PMHA, dahil yun din po actually ang isang challenge na kinakaharap natin, kulang na kulang po tayo. But in 2019, PMHA used to be Baguio Benguet chapter only. So in 2019, it became Cordillera chapter because our goal is to reach to the other areas of the Cordilleras. So today, we are coordinating po with the provincial health offices sa mga ibang provinces sa Cordillera. And we are encouraging the teachers from the different schools outside Baguio and Benguet to reach out to us kung ano po yung pwedeng assistance na pwedeng naming ibigay sa kanila. Thank you.
Thank you, ma'am. I think you also have a question with regard to CSOs, whether they are well capacitated. Tama po ba?
Yes.
Was that the question? Maybe we could direct it to...
Since I am representing CSOs right now, volunteer. Can you please repeat the question regarding volunteer
care po.
Volunteer care
ng mga CSOs.
Yes, ng mga CSOs. Actually, that's #1 challenge right now. And we're doing something about it so as to protect us also. Yes, and that's very, very good and nice question. And really, we really need that protection, that kind of protection. Next is the training for any focal group or FGD, focal group discussions. Yes, we have a lot of trainings right now. Ang ginagawa po namin bilang CSOs ay lumalapit po kami, gumagawa po kami ng isang program or activity design. Then, nire-reproduce po namin ng marami, tapos binibigay po namin sa mga line agencies, tapos kinukulit po namin sila. Ganun po ang, this is mental health, so that's the reality. Okay? That's the reality na nangyayari. Mahirap siya, oo. Minsan kailangan ko pang mamalimos, tama. Pero, yun yung nakalagay doon. Pero, as time goes by, nakita ko yung improvement na ngayong pinag-uusapan, mas madali na sa mga CSOs natin na magbigay at maglabi ng mga iba't ibang programs nila to be funded. So, nakakuha tayo ng iba't ibang capacity training sa DOH, then nai-involve natin yung mga youth, meron tayong nakikreate na naging member sila sa Mental Health Council representing the youth, kasama natin yung mga nasa members ng Local Youth Development Council. So, I suggest na yung mga CSOs natin, like for example, yung sa inyo, sir, you try to register sa DILG, tapos sa NYDC, National Youth Development Council, or LYDC, the Local Youth Development Council, para mas magabayan pa kayo on how to manage yung kailangan ninyo and yung needs nandyan po, pero may proseso nga lang tayong kailangang gawin bilang ito'y proyekto po ng gobyerno.
Okay, thank you so much for your response, Sir Kiki. Would anyone want to add pa po or my follow-up question? I think just to pick up on one question a while back, I think it was about bakit or ano nga ba yung na-prevent from students from going to guidance counselors? Is that one of the questions? Parang ganun ba?
Yes po, meron po for schools po. And sana meron nga, sabi ko po, malalaking posters sa mga main gate pa lang para pagpasok.
Infographics.
Yeah.
Sir, let me answer the question. We have the Zero Suicide campaign of the city. And we provided all the university. You can check your bulletin boards. Nandun po yung mga sticker na malalaking numbers po. Andun po lahat, PMHA, lahat po ng DepEd, BGHMC Psychiatry. Andun po lahat. Punta po kayo sa mga bulletin boards nyo kasi lahat po ng mga universities na bigyan natin. And tama po yung sinabi nyo, kahit sa jeepney po meron po kaming pinag-sticker na maliit na nilagay doon na stickers. So, sa mga public utility vehicles natin, meron po tayong mga stickers. Yun lamang at sa mga bars, wala pa. Tama po yun. Although hawak po natin, or we're under sa Health Services Office, isa rin po yun sa mga kinikater ng Health Services Office. So maybe we can collaborate and noted po yan, sir. We will take that recommendation. Thank you.
Yeah,
Thank you po.
Thank you. Yeah, and we know that you had a few more questions, but maybe later on we can connect you with one of our the members of our panel para masagutan nila better yung questions nila. But we'll now invite a few more to give their own questions for our panel. Go ahead po.
Please introduce yourself, sir.
Good morning po. I'm Jude Castillo from the College of Nursing. So, dito po sa University of the Cordillera. So, meron po kasi akong encounter ng two separate occasion wherein I have two friends from different schools na sabi po nila there is an issue when it comes to confidentiality when it comes po sa pagko-consult sa mga guidance office sa kanilang schools in which guidance counselors are not being very subtle when it comes po to the disclosure of information regarding po sa napag-uusapan nila within the office. Since it is supposed to be a safe space for students, paano po kaya natin ma-address yung issue na ito regarding po sa yung ano po dapat sana yung limit na mabibigay natin sa mga guidance counselor when it comes to sharing po ng experiences ng mga na-encounter nilang students during their counseling sessions. Yun po. Thank you.
Thank you for that question. I think this question is could be very well answered by Ma'am Maker from DepEd, ma'am.
Good morning, sir. So yung parang ang tinatanong mo, paano ma-break yung confidentiality?
I think ano po dapat sana yung action na gawin kapag may mga ganong issue po regarding sa sharing of information. Kasi I think yun po yung isang reason na naghihinder kung bakit may mga students po na hesitant to go for guidance counseling sa mga schools po because of that.
Kasi sa guidance in counseling, sa pagkakaalam ko sa mga kasama ko rin, parang tanangin mo muna yung bata kung gusto niyang i-share yung problema. Hindi po basta-basta kasi na i-share ng bata yung problema na yun kung ayaw niya. Pero yun nga yung nasabi namin ni Ma'am Nina, na mababreak yun talaga kung i-refer mo, sabihin mo sa ibang tao na parang trust mo na makakatulong sa'yo. Yun kasi yung parang nagets ko sa ano mo sir, sa school, kung nag-share, kailangan...
Yung ano po mismo, guidance counselors, kasi based po dun sa experiences is hindi po sila subtle sa pagbibigay ng halimbawa. Okay naman po kasi to share the experiences of students na na-encounter nila during their counseling sessions. Pero I think during dun po kasi sa case na yon is parang masyado pong halata kung sino yung student na na tinutukoy nung sinishare po nila yung information.
Parang sinishare nila ba?
Yes po.
Ay, kasi bawal po sa amin yun.
Kasi
may training kami kasi na as a guidance counselor, hindi po pwedeng ma-share yun. Dati kasi akong guidance counselor sa 2 school dito sa Baguio City. Talagang ang pinopoint namin, pag may mga confidentiality talaga dun sa school, kami lang nung parent or nung bata at ng advisor. Tapos tanungin ko sa student kung gusto niyang i-share doon sa advisor niya or sa mother niya, doon kami may conference po kami, may individual conference or group conference po. Pero yung sir, yung i-share mo kasi sa ibang tao, hindi po siya nandun po sa ethics, code of ethics ng guidance in counseling, sir.
So yun po siguro sa tingin ko is dapat na lang pong ma-emphasize po sa mga...
sige sir. Di bali sir, may training po kami na gaganapin this October siguro sa mga guidance counselor inter-Cordillera para at least mapag-usapan yan sa training din ng mga guidance counselors po. Kasi magkakapacitate din namin mga professionals, guidance counselor din po sa ganyan, sir. Thank you sir for sharing po.
Thank you po.
May I just add? I'm sorry, sir. Sige, sir.
Dagdagan ko lang yung sabi ni kanina regarding sa confidentiality. We will emphasize that one even sa ating mga trainings, ni-emphasize natin yung pag-share na hindi talaga dapat yun. And then, since nabanggit niyo ulit, we will re-emphasize again, especially with our provincial coordinators na mental health sa different agencies. And even sa regional agencies natin, that they can also provide memorandum siguro o kaya administrative order advisory to emphasize the privacy o yung confidentiality ng ating mga kliyente at mga learners natin. Thank you.
Sorry, permission to speak. Bago po makalimutan, yung part din po natin bilang estudyante, sharing of those videos is breaching the confidentiality. And it wouldn't help anyone. So please, kapag may mga ganong information, stop sharing, report, block. Yun po. And confidentiality can be breached sa amin po as a health worker. Tatlong pamamaraan. Una, na-mention kanina, kapag may balak siyang saktan ng sarili niya. Pangalawa, kung may balak siya or meron ng concrete plans of suicide. Or pangatlo, agtalaw isuna or pumanaw isuna jabalayta or aalis sila ng bahay. So yun pong emphasize natin before conducting any, and of course the consent. Ayan, of course the consent. So yun po yung mga bagay na consideration natin. And I'm so sorry to hear those experiences, sir. And yes, that's true, it's happening. We have to accept. And yeah, this is a long journey. And together with the DepEd and all the line agencies, we will we will be one with you in this kind of promoting confidentiality in all the aspect of mental health. Thank you po.
Nasabi na ni Sir Ricky, yung if the person is suicidal, hindi na po tayo hihingi ng consent sa kanya kung pwede nating sabihin sa parents niya. Or if the person is homicidal, kung naniniwala ka na meron na talaga siyang balak na saktan ng ibang tao and balak na agtalaw.
Yeah, and then just an additional, kasi nga, because psychologists and guidance counselors, their professions are regulated. So if ever there is any misconduct din na ganito, we can actually put it in writing and, report the incident. Kasi that's really part of the regulation of the profession. Yung ethics, ethical care and ethical behavior.
Thank you very much for all your inputs and thank you for your question. Maybe we can accommodate one more question from our physical audience before we proceed to the questions which we also gathered from our registration and from our viewers online. Yes, ma'am, your name please.
Hello po, my name is Jillian. I'm from UC Psychology Behavioral Science Society. May dalawa lang po akong question. So, basing on the data that was presented earlier sa Usapang Mental Health, what are the needs and the gaps that the Department of Health have identified? And ano po yung mga mechanisms that was done or balak pong gawin to address it, especially po sa mga remote areas?
Okay, so thank you for the question, Madam. With regards doon po sa nai-present natin kanina, ang isa talagang need and concern natin, ito po ay mga reported cases lang. Ang dami pang mga hindi pa po reported cases. That's another concern. Another one is that itong gaps talaga is that di alam ng mga nag-attempt na mag-commit ng suicide kung saan sila, yun yung isang challenge talaga natin, saan sila pupunta. That is why ang isang intervention natin sa mga even sa far-flung areas is to capacitate them and to help them, support them. Kung ano yung mga existing na kaya nilang ibigay, ay ibigay nila or support natin para maibigay kahit sa mga far-flung areas. Kung hindi nila kayang ibigay, ano yung need nila na pwede naman nating ibigay sa regional office, sa provincial office, and then pwede nating isupport sa kanila. Very complex po kasi kapag sa mental health ang pinag-uusapan natin. Pero ang tinitignan natin dito is that kung ano yung available resources na nandoon mismo ay pwede nating ibahagi agad-agad sa mga nangangailangan. With regards po sa mga far-flung areas, yun din ang isang concern natin, lalo sa mga GIDA areas natin, na ang isang rason bakit hindi nagpapagamot ang isang tao. Kasi ang layo ng, may isa, 8 hours na maglalakad, papunta, tapos 8 hours na pauwi. Kaya pati yung pagkuha ng kanyang ayuda, pupunta siya doon, pag uwi niya wala na kasi kinain na niya sa kanyang daanan. How much more yung mga may pinagdadaanan o kaya may mga mental illness na sabi natin. So that's also a concern. That is why one of the things that we are doing is that we are prioritizing yung efforts natin and concerns natin kahit sa mga GIDAs natin. And I'm not saying na marami tayong nagawa, marami talaga tayong pangangailangan, but we will get there. And the mental health is really a concern that we need to address. Thank you, ma'am, for that. And we'll take note of your questions and suggestions. Thank you.
Let me add on that, ma'am. World Health Organization identified the gap wherein we are lack of clinicians, at the same time professionals in addressing clinical problems when it comes to mental health. That's the reason why they released the MH gap or the mental health gap for non-clinical setup. So this is actually online. You can access it online. It addresses the 5 issues or concerns under mental health. And this is a training for non-specialized clinic or setup. So as you can provide at your level first aid or in any intervention in your level. So right now in the College of Nursing, we have this is one of their subject. I think, subject for MH gap. So this is an algorithm on how to help you or guide, but this is not a diagnostic tool. This is not a diagnostic tool. This is only a guide for you, mas lalo na sa mga nasa far-flung area and na wala pong mga mental health professionals. And this is also a guide for you when, where, and how to seek for help. Yan. So please, you can take note of that, the MH gap.
Last po, so it is evident that in the Philippines, we lack psychologists and guidance counselors. So the question po is, do you agree that the best solution is to downgrade the academic requirements for guidance counselors?
Yeah, any one of our panel members may.
As a member of the Philippine Guidance and Counseling Association, yan kasi ang isang parang sinasabi na naibaba, pero ang ano rin kasi namin dun sa association, it's upgrading of your mental health or yung sa isipan. So, we hope na hindi talaga ibaba yun, sir. Alam ni sir, kasi doon sa Psychological Association of the Philippines din, mag-partner din kasi ang guidance in counseling. Galing ako as psychology graduate ako, tapos na guidance in counseling, graduate ako ng masteral, and now sa doctorate ng guidance in counseling. Kasi nga, ang hirap kasi na ibaba mo, it's a law, Republic Act 9258. So, we hope na wag sana. Kasi ang ano lang sana natin is i-invite natin kung sino pa yung i-enroll or mag-encourage po tayo na pwedeng mag-aral ng guidance in counseling. Kasi nga, dito sa Pilipinas, talagang kulang po tayo. Ang dami pong na open na items for guidance in counseling, pero yung sweldo po ng guidance counselor is mababa. Ang dami actually ng guidance counselor, pumunta na sila sa school, nag-master teacher or teachers na sila kasi yung standard kasi ng mga teachers is mataas sa DepEd. So pumunta na yung ibang kasama namin na guidance counselor dun sa private as consultant na lang. Po. Yun po. So we hope ma'am na hindi po hindi maibababa yun.
Ma'am, may I add po? In response po dito sa problema natin sa kakulangan sa mga professionals. That is why we are training po yung other professionals and other volunteers to become mental health advocates. There is a training on psychological first aid which everybody can do. Hindi nyo po kailangan na maging psychologist or guidance counselor or a doctor to provide psychological first aid. So, meron po yun.
Thank you very much to our panel members, and I hope they were able to answer your question. We also received an overwhelming number of questions from our registration portal, and to just accommodate this as well, may we just read one of the questions from our registration portal before probably we ask the question from our physical audience. Doc, ano po yung tanong ulit sa registration portal natin?
Ayan, this is a very interesting question kasi some of the questions were already answered during the discussion and then through the other questions. But this is from Ms. Jasmine Dumacion of the Bureau of Jail Management and Penology. Are there any mental health services available to those under detention or to our PBLs? Ayan. So are there any interventions or programs? Any one of our panel members may also.
Yes, please. Thank you very much po, Ma'am Jasmine. That is Jasmine. Opo. With regards to the intervention doon sa ating Bureau of Penology, mayroon pong mga ginagawa ang mga officials natin doon. They are partnering with us sa DOH. So ito po ay intervention from the jail. Nakikipartner sila sa BGH, sa CHSO, at sa DOH. At kung sino pa ang pwede na available civil service organizations in which they are promoting mental wellness. I remember when during yung pandemic, ilang series of online talk na initiative ng Bureau of Jail natin, BJMP natin, even here in Baguio City. Now, concerning naman sa mga gamot, pwede po silang mag-request sa atin o kaya sa CHSO kung may mga pasyente na nakita doon na mayroong mental illness, pwede silang mag-request ng medicines at pwedeng ibigay po sa kanila. So, yun po. And we would like to congratulate even yung sa ating mga BJMP officers na binibigyan nilang pansin itong mga PDLs natin. And thank you so much for that. Yun po.
Thank you, Sir Shamgar. So, ayun ay katanungan with regards naman sa ating mga persons deprived of liberty. Meron din po tayong katanungan mula sa ating mga audience from our Facebook live stream. At ang kanyang katanungan ay, what are the mental health programs or services also available for PWDs?
Or persons with disabilities.
Or persons with different abilities?
Yeah.
The City Social Welfare Development Office and the City Persons with Disability Affairs Office po ng Baguio City nakikipartner po sa atin for their clients to undergo psychological assessment. Kasi kailangan po ito for them to have their PWD ID. So if they have that ID, meron po silang discounts. So, nakikipartner po sa atin ang si Sir Sam ng PIDAW. And for the PWDs who are indigents, hindi po nila kayang bayaran ang psychological assessment fee natin, we partner with the City Social Welfare and Development Office for them to shoulder the psychological assessment fee of these indigent clients. Yes po. That is the same din po with the municipal social welfare offices natin sa mga iba't ibang LGUs natin. If you want po to avail of mental health services at wala po tayong pambayad, please go to the city social welfare offices po. And they can help you with the finances po.
Okay, so meron nga talagang socialized fees, kumbaga, or services to actually help with the provision of that care. Yes, sir?
In behalf of the city, we have also our mental health unit, wellness unit, sa T. Alonso, 4th floor, room 4. So doon po ang opisina natin. And everything po doon is for free. And for the PWDs, we have allocated medications na hindi po under sa neurologic disorders. So, yun po ang inaantay po natin na may release and it will be available. And lahat po ng psychosocial support na pwede nating maibigay, ibibigay po natin. And closely coordinated din po tayo, sabi nga ni ma'am, sa PIDAW office or Persons with Disability office sa Mayor's office po. So, yun po. Kung mga services po, pwede rin pong pumunta sa Mayor's office sa PIDAW or pwede rin pong pumunta sa amin sa Health Services Office aside from mga partner agencies po natin.
Yeah, thank you so much for that information. And at this point, in the essence of time, we'll have one last question from our physical audience. So, ito, ayan si sir. So one last question, and then the rest of the questions we'll try to forward to our panel for them to answer later on. Go ahead, sir. Introduce yourself and give your question.
Good morning, everyone. My name is Erickson Marcelino, a public administration student from Benguet State University. I don't have a question, but I have a suggestion. Yesterday, while I was browsing on the internet, I don't know if everyone seen the unfortunate news wherein a body was found hanging on a tree sa La Trinidad. The body was identified as male, 15-year-old and a grade 10 student. And as also shown on the data a while ago, from 14 to 21 years old are prone from committing suicide. Now, my suggestion is, can we create an online platform wherein everyone can message and seek for consultant, and an online platform wherein everyone can share their stories on how they conquer their problems, and us also to boost their confidence in facing their problems, especially po sa ating schools. Schools wherein we have a bad connotation when we heard the news guidance counselor. No, why can we create a online platform sa ating schools where the students can share or can share their bad experiences po sa na-experience nila. Thank you.
Okay, thank you for that question. Ma'am? Okay, si ma'am could make clear.
Good morning, sir. Sir, yung regarding dun kasi sa online, parang mahirap kasi yung ano sa amin as a guidance counselor, mas okay kasi yung parang kasama ko siya na nag-uusap kami. Pero yung parang i-ano mo kasi sa online, hindi mo alam kung mahahack or ano yung ganyan na paraan. So we usually as a professional, mas maganda na lang nakausapin ko yung bata. For example na merong ganun. Kung online, hindi ako ano doon sa online pag ganyan na confidentiality na yung sinasabi ng bata.
We are also aware that everyone has a Facebook po, ma'am, and I think and I believe that using a online platform will be a great response on addressing a mental health awareness po, ma'am. So when it comes po naman sa hacking, there's a app wherein you can hide your identity, or a lot of students can create an dummy account on sharing for their problems. And yun po.
Yes, thank you, sir, for that question. Yes, we are trying, as a CSO, we're trying to address it through the use of quad media. And in anxiety support group, it is a private group where you can type, sa Facebook po, type mo lang po anxiety and depression or ADSG, anxiety and depression support group. And you can, pakikita nyo doon, naka-anonymous yung mga nag-share how they, so it's a sharing of it's a support group basically that online you can post your own story and you make it anonymous. And yung iba po doon, nagpo-post din po ng hindi na ako naggagamot, pwede nyo na itong kunin ng free. Just message me, mga ganon. So, it's a community. It's a community. However, before, I did not foresee it coming na hanggang Visayas and Mindanao magme-member doon. And yun siguro yung limitations natin. But however, still mental health, ina-accommodate pa rin natin sila. So yes, sir, we have that page. And for us CSOs, ginawa po namin yun dahil nung pandemic. So nandun din po yung mga linkages po natin. Thank you po.
Right. So maybe baka later on we can link you with Sir Ricky so that you may also get to know the process. Ano? And also siguro to be aware of, kasi sa social media there might be groups that might lure us into thinking na it's intervention tas hihingian tayo. Those are also scams. So may ganun din kasi na added layer. Kaya I think that's what is also preventing us from doing online.
Yes, tama yan, partners. I think we also need to be vigilant as well. Again, for those who have sent their questions and sa ating mga physical audience,
thank you.
We know that you still have a lot of questions in mind, but don't worry, although we have to limit the questions that we need to accommodate for this episode because of the limited time. Do not worry because bukas po ang ating mga tanggapan where you can send your questions. Kilala na po natin ang ating mga panel members. You can contact them, you can go to their offices, and then you can ask for whatever questions you have in mind in relation to our issue. And so, at this point, we would like to call the board chairperson of Pansigadan Advocacy Cooperative to give us a synthesis of what we have talked about. It has been very overwhelming ang mga questions, ang gaganda ng discussions, and but I think lahat naman it has come to an end, no? So let's welcome on stage Ma'am Betty Listino.
Hello, magandang tanghali na po sa ating lahat. Kaya pa?
Kaya pa po.
Nalulungkot na daw sila at gutom sila. Sige, hindi na natin patagalin ito. Just give us time lang na nila yung presentation. I just want to, hindi ko na po uulitin. I think, palakpakan naman natin mga sarili natin. You're such a very good audience. Ang tatalino ng mga katanungan, kasing talino din ng ating mga panel members at saka ating mga reactors. Unang-una, nagpapasalamat po ako sa pagtawag uli kay Pansigadan Advocacy to be part of this. Kasi simula lang namin din last year. And naalala ko noong nakaraan po na Dagyaw natin, ito din po yung usapan. And I think we all agreed na kaya nga natin ito ginagawa through this platform na Dagyaw because I think last year we emphasized that together is better. Na if we do this together, the public sector, the private sector, and the civil society organization in general, we can do better. In understanding a problem like mental health, if you speak about issues, any issue naman talaga, di ba? Kunyari, tinatanong tayo sa mga kasama kong estudyante, di ba, may problema ka ba? Tapos ang sagot komplikado Wala naman talagang problema hindi komplikado. How much more with a big issue like this, napakabigat na usapin, no? Napakakomplikado. And I just want to, next slide please, just so na to synthesize, kasi hindi ko na isa-summarize, just to synthesize or distill what we have talked about this morning. I just want to present a mental model that will help us do this. In understanding any situation or a problem, we always look into what we call the iceberg model, no?
Yeah.
And kapanahunan ba ninyo si Titanic, yung palabas na Titanic? Raise your hands. Mga katulad ko na nanood noon nung high school ako, ganyan. O hindi daw. Walang nakapanood sa inyo? Hi!
Wala.
Okay, hindi nila kilala si Titanic. So hindi nyo alam si Rose at saka si Jack. But anyway, we all know the story that the one that sunk the Titanic, which was thought to be unsinkable, was an iceberg. And they only started to understand that because yung nakita nila yung iceberg. Ano ba yung nakikita natin pag sinabi nating iceberg? Iceberg na yung ice ha, hindi yung lettuce. Yung ibabaw lang nakikita natin at yung kunti lang niya na part. And usually what you see is just, 20 or 10% of the entire thing. But if you would see yung bottom niya, ay ganun pala siya. Napakalaki. And the same with any problem, no? Ang nakikita natin usually, when we hear about mental health even, alam lang natin, na-associate natin sa mga na-observe natin. And kung may mga nangyayari po, na mga yun, ang na-share na kanina, tsaka na lang natin siya naiisip. Pero usually, if we dig deeper, kung yun lang yung, sometimes, yun lang yung tinututukan natin. And most of the data presented kanina, we only dwell on suicide cases. And most of them, ito lang yung mga reported. So yun yung mga nakikita natin. We really don't know kung bakit nga naman mababa sa ibang provinces. Bakit yung top 3 lang na yon, Baguio, Benguet, and Mountain Province? Tama yung pinoint out ng ating mga reactors. Maybe because ito yung mga mataas siguro ng awareness. Mas malapit sila sa, technology to report it even. Or mas maboka lang sila. It can be many factors, no? If we look deeper, marami yan makikita natin. And there are patterns already underlying there. And from those patterns are structures. And yung pinaka-bottom po na pinaka-importante is the mental models that we have surrounding that issue. So with that, let me just put some points based on our discussion kanina, no? Next slide, please. Okay, dito. Mas maliwanag yata. So, what we see, or what we saw kanina, rising cases of suicide attempts, 508 reported cases in 2023 according to the DOH data. And most of these data are from hospitals, or basta reported siya. And the top 3 areas I've mentioned already, Baguio, Benguet, and Mountain Province. The age range, or the age groups affected, at least, nasabi nila, the adolescents and the young adults. So, of course, na-mention kanina yung about hormonal changes. These are the times kung kailan nagre-rebelde ang mga bata. And it starts already to tell us na yung locus kung saan the intervention should happen, preventive man, lalo sa preventive ay kung saan ang mga itong age groups na to. And most of them, schools, you have 2 types. Meron yung primary and secondary schools, and you have the higher educational institutions, just like this school, University of the Cordillera. Then you have also yung means, which is mga lethal means. In Baguio, maybe strangulation. But in Benguet, maybe chemical ingestion. I'm very sure of that. We have conducted studies relating to this already, several already. So the availability of lethal means, ay talagang ano din yan, isang dapat pagtuunan ng pansin. So yun yung mga nakikita lang natin. But underlying this, below this one, are the patterns that might have been happening over time. What has been happening over time? What has been happening is, meron na tayong mental illness problem. As a society, meron na yan. Nangyari, hindi natin alam kung saan nagsimula. Meron na yan. Maybe studies would eventually emerge. Siguro yung ano din dito, we would like to hear also from the research community. It would be nice to hear from researchers that would also present these ones. So also to contextualize the data we are hearing. There is also a dysfunction in the family and it correlates, no? So, parang nangyayari na to noon pa. And ano lang yan, nagkaroon lang siya ng stimuli, which is, or stimulus, which in the case of the pandemic, biglang sumabog siya. Also, there are societal issues that maybe has been happening as they have been happening, and we have not been very careful in addressing them. So, for example, the availability of lethal means. So I would like to point out, there are regulations surrounding the access of lethal means, just like very toxic pesticides. And some pesticides would not have any antidotes. And the unregulated selling of this have contributed to their access. And that's why the attempt is just one, but the completion of that attempt in the case of suicide is another. Hindi, pag-uusapan pa natin yan. So, most of the time, because in researches we have conducted in the past, we also have talked about this na hindi naisip ko lang, nakita ko, ininom ko, hindi ko alam naman na wala pala siyang antidote. They've been crying at hospitals. We still have to listen from the voices of doctors who attended to these patients. Na they will tell you stories about people who have been nagre-regret sila and they want to survive. Unfortunately, the doctors are helpless because they could not provide any way to save the patients. So, yun yung mga ganun po. And these have been, nangyayari na po ito for a long time. So, yun siguro. Ang maganda nating nakita naman, okay, while these are, meron naman ng, in terms of the interventions that we have, supposedly wala ito yung third na yan. Kasi noon wala naman talagang ordinansa supporting mental health. It's just now. And thanks to the hard work of our advocates and our volunteers, the CSO groups, really. Of course, we have the mandated government agencies, but without the CSOs and the volunteers, I don't think it would really go far. Because to do this, you have to have a motivation, and motivation should be fueled by passion. Passionate people are resided in the CSOs. Di ba CSOs? Of course. We say that to ourselves. Okay, and of course, yung underlying dun sa bottom is, what are the underlying mental models dito? Hindi kasi yan tinitingnan ng magulang. Na-mention na kanina, tayo ko nang ulitin. The parenting. And that this is where our religious sector, the spiritual side or sector of our society would come in. They are the ones who would be the institution to support the family also as an institution. Pag nagkakaroon ng breakdown, syempre meron dapat support to support this the nuclear institution of our which is the family. Mental health literacy has been pointed out. From awareness to understanding, and sa kasama namin sa Pansigadan na-mention niya ito, it's very important that there is a level. Okay? A level. First is awareness. And from awareness, you will have to have understanding that will influence your opinion. Maybe it will change, hopefully. And by consistent effort, your behavior. And actually, that would lead into desirable actions. Kasi meron din undesirable actions. No? And then, of course, stigma. Alright, presented in another way, if you are mahilig kayo sa logic model, pwede na namang we can understand it this way. So yung situation natin dito is the rising number of suicide cases, the low mental health literacy. There is also a discussion that should that we should talk about availability versus access of mental health services, and again, stigma. You will see here on the upper, you see the illustration, the upper portion is government intervention. The lower portion are the interventions of the civil society organizations. In the middle portion there, I have to put there the convergence efforts. So, you will see here, and kudos talaga sa ating agencies, sa CAR, palakpakan naman natin sila, that, yes, hindi naman sila mabilis ang kanilang paghagip. And they know very well that in their minds, they know how to sustain. The sustainability is always the key. Kasi tayo sa CSOs, we only operate on what we have, and what we have is ourselves. Okay? So, meaning, hanggang doon na lang. Kasi minsan, kung wala ka ng kasama, wala ka ng pang-mobilize, nahihirapan talaga. And as much as our approaches are very creative, our strategies are very on point, it's very difficult to sustain if you do not have the support of the public sector. So then, it's important to institutionalize mental health programs. It's important, and this is kudos to Baguio, the City Council, palakpakan naman natin. Sana lahat ng council ay gano'n, local council. Meron silang na-form na mental health council. Of course, La Trinidad, we will not forget, La Trinidad. And we are supporting Kapangan. Hello to Kapangan. I'm sure Atok will susunod niya yan. Minimension ko na sila. And of course, the provincial governments, Benguet. Hi to Benguet, I think nakasalang na ito sa mga kalan nila. And yung mga na-reach na rin namin, like Mountain Province. And susunod na yung mga ibang provinces. So we also want to hear voices from the CSO sectors ng mga ibang provinces. Hindi na natin narinig. Ifugao, Kalinga, Abra, Payao. Hello to sa mga nanonood pong mga partners natin. So yun, yung clinical diagnosis and psychiatric consultation, it's good that PMH is there, but there's only, among the CSO sectors, yung nagpo-provide ng ganito, hindi ganun kadami. So for Benguet, at least meron sa Pansigadan and yung New Baguio Benguet. Dalawa. How about the other provinces? No? They will have to increase. Kailangang madagdagan ito because yung mga nakabase sa mga hospitals natin, which, of course, Baguio Medical Center and si Benguet Gen, meron na ba? So, yun po. Crucial yun. If we are to address yung availability versus access, So, available nga siya pero hindi accessible. And we, honestly, let me just say this one from the side of the private sector. We also want to provide this in the very yung help na ito or yung access na ito. In a manner na kayang i-afford ng client. And ito siguro yung moving forward natin. No? Kasi ang hirap. Okay, nasasabi natin na available, but when they come, everything comes with a cost when in terms of also trying also to uphold the profession. These are professional service providers and you really have to provide the right rates at the same time. So, ako, practical lang na usapan yon. And maybe there should be a way for the private sector, the CSOs, and the government agencies to really talk about this. Let's talk about that. Let's be comfortable about talking about this. No? Kasi kailangan din umarangkada ang mga clinic, kailangan din nilang mabuhay. And the dignity of the profession as well. And as much as we want to give free, ang hirap, sabihin mo kay doktora, free forever, ang hirap yun. Yun po. So, in overall, malapit na po ako, kayo mag-alala, yung parehas na intervention na for both, which is good, yung middle point nila is continuous both ways na may capacitation, yung frontline health partners, including volunteers. Dito yung nakikita nating point of convergence. And the promotion of mental wellness, especially in schools and communities, at least another point of convergence. This is really very, anong tawag nito? It's really very good. And that's the reason why we have come to meron na na-establish na referral system. We cannot say this maybe to all provinces, Baguio, and meron sigurong established. We are exploring this pa in Benguet. There is convergence among agencies and advocates. Again, we can only say this for Baguio and Benguet again. We cannot really conclude this for all throughout the provinces. Yet the advocates from the other provinces still have to come forward. It's good that policies and structures supporting mental health initiatives are already emerging pa. Okay? Next slide, please. Okay, just focus on the middle. Marami akong bilog. Mahilig ako sa squares and bilog. Pero para mas maintindihan, no, I just want to point out here roles and relationships. What you can see here na dikit, yung mga nagkakadikit, yung mga magkakakilala, obvious ba? Sa public sector, you will have their hospitals as the main source of data. And that is where nakadikit si Department of Health. And that is what we heard. I want also to emphasize that there are other sources of data in which that is the research community. Where is the research community for mental health located? Maybe a question that we should ask ourselves. Okay? So, as you see, HEIs, they are the ones that could really bring out this. And yung mga consortium, which maybe we should solicit later on. So, importante yung data dito in terms of roles. You know, the hospitals cannot just be the source of data because the hospitals, yun lang yung mga ino-hospital na talaga na usually mga cases na talagang in terms of suicide, for example. How about other sources of data so that we can really see a picture of that? Okay. Ang nakita natin dito, just to summarize, meron kang the primary and secondary schools, at least for your age groups nung ating sinasabi kanina sa data, very well surrounded yung kaniyang ecosystem of players, of stakeholders. So, this is the ecosystem where our mental health advocacy or any program or any initiative is playing right now. And that is the place. Meron akong mga faded lines dyan, yung mga distinct lines, sila lang yung well-connected. So yung mga medyo weak yung connection, siguro yung palawigin natin. Medyo malayo yung sa CSO. From what I'm hearing kanina, medyo malayo sila. And yet they have the most creative and the most passionate initiatives. Medyo hindi sila lumalapit masyado doon sa kung saan yung action. So siguro yun yung tingnan natin kung paano pa yun palawigin. But it's good that the LGU, so yung nakikita natin dalawa dito na locus na kailangan i-strengthen is the LGU. And when I say LGU, that could be the PLGU, BLGU, MLGU, no? Tatlong levels. And then the schools, we will be speaking about the primary and the secondary schools. HEI siguro, the formation of support groups here, but also please include them sa research. I would really encourage that the HEIs would include mental health as part of the research agenda. Okay. So yun po, in conclusion, last slide please. At bago na tayo kumain, ay wala palang pagkain or umuwi. Yung tinitingnan natin dito ay kung ano yung nakikita natin sa top of the iceberg. What we provide is what we call direct service. And usually direct service is very expensive. And that's the reason why let the government do the direct service, because it's very expensive. The provision of clinical support is very expensive. Or find ways na pwedeng pumunta tayo sa scaled direct service. Kasi doon kami. Usually, for our case, in our case, sa CSOs, we always also find ways to do that. When we capacitate these guidance counselors, for example, ng mga schools, that is better than directly serving mga students. Because the guidance counselors could directly serve the students, di ba? Parang ganun siya. And maybe it's very important that as CSOs, and I will speak to our community, we should know how to place our energy well. And our role well. If you are a practitioner, for example, maybe the best for you is to really transfer that knowledge. And that knowledge will be multiplied. The exponential, or maybe we could say the multiplier effect, or the exponential effect of just sharing would really go far than just providing your direct service, diba? So that we can really come up with a new system. of how to provide interventions or support surrounding mental health. So that's all from us. On behalf of Pansiganan Advocacy Cooperative, we thank you. We thank you, online audience, our live audience here. Thank you very much for your attention.
Thank you very much, Ma'am Betty, for that comprehensive talaga na synthesis of today's discussion. Buo na ang ating output for the future directions. And now to formally conclude our episode for today, let's hear the closing remarks from our partner from the Council of Restoration of Filipino Values, National Director Nathaniel A. Sakiba.
A pleasant day to all the regional heads of line agencies of the government, to the heads, chairpersons, or presidents of civil society organizations, to all the distinguished guests, and to everyone who is here present and those who are joining in the online platform. Thank you for your presence in this meaningful and significant event. First of all, we would like to express our heartfelt felicitations to the organizers of this event, particularly the Department of Interior and Local Government, with the assistance of the Philippine Information Agency, the University of the Cordilleras, and to all who contributed to the success of this event, for coming up with this platform as an avenue for us to discuss these critical issues that adversely affect the well-being of the different sectors of our society, thereby broadening the participation of the members of the community in good governance. As we listen to the discussions and presentations on mental health this morning, we can see how timely and important to discuss this very crucial matter due to increasing suicidal rates in our region and other parts of the Philippines. Our deepest gratitude and salute thus to the efforts and interventions of our health department, the Philippine Mental Health Association, the Department of Education, the Bureau of Jail Management and Penology, the LGUs, and other healthcare groups in protecting the mental well-being of our community. However, I believe that they cannot do it alone. It takes the collaboration of both the public and private sector, just as what we are employing now, the whole of government and society approach. It is noteworthy to emphasize that we are stakeholders to the plight of every member of the community, as well as to the younger generation, who are very much vulnerable to anxiety, depression, stress, and mental disorder due to their exposure to violence or being victims of violence themselves. Let us remember that a witness of violence is a victim of violence. As young children, they deserve to live in peaceful, loving, and caring environment. Consequently, their potentials will be unleashed and they will excel in various fields of endeavor. Their minds and memories will be so sharp and they will be brilliant students in various educational institutions. They will make us proud in sports and other national and international competitions. They will carry the name of the Republic of the Philippines in their inventions and discoveries. Without gainsaying, we cannot discount what our children and young people can possibly do because they are at the prime of their life and they are at the peak of their strength. Let us remember that our dead heroes were at the peak of their strength. Let us remember that our dead heroes were at their young age when they fought for our national independence. In the same manner, our next generation can help us realize a bright future for our country. However, we cannot expect such laudable achievements from them if all the while they are tormented with traumatic negative experiences or all the while they are mentally and emotionally disturbed. I myself, as a parent, I cannot imagine how my little child in his very tender and inferior state could ever bear the responsibility of an adult or mature individual. But there are some who are forced to assume such burdens. They are compelled to work and make a living for their younger siblings instead of enjoying their youthful age. There are confusing circumstances beyond their understanding at their tender age. There are some who were molested, maltreated, sexually abused, or victimized by their own parents or close relatives. There are some who learn how to sell or use prohibited drugs, or steal, or cheat, or commit criminal offenses because their parents or family members themselves taught them how to do it. The home that is supposed to be a safe haven for the vulnerables has become a place of attack. All these are shocking to the senses, yet a reality among our youth and little children. We need to rescue them from this dark era of life. They need to come out from such a hostile and perilous state. They need to be in a peaceful state that will also protect their mental well-being. All of us have a role to play to minimize these root causes of mental problems. As parents and members of family, let us do our best to make our houses a home that leads to happy, healthy, and fulfilled life. This may be a gargantuan task, but we believe that this is possible with the cooperation of all sectors of society. Together, we can. God bless everyone.
Thank you very much, Sir Nathan, for that closing message. Yes, and of course, we would also like to thank as well our panel members. Thank you very much for your insights.
Salamat po.
We also would like to thank our CSO reactors. Very valuable insights. Thank you very much. And our organizer for this Dagyaw, of course, maraming salamat po. And thank you very much sa lahat who joined us physically and virtually for this Dagyaw 2023. Palakpakan po natin ang mga sarili natin. Yeah.
And that concludes Duro Partner, no? Episode 1 of Dagyaw 2023. And alam natin na maraming natutunan ng ating mga participants. Tama po ba? Yeah. Ayan. Resounding yes. Sana sa ano din natin, virtually, definitely meron silang natutunan, no?
That's right, partner. And we really are very hopeful that this Dagyaw could be that push towards more collaboration between the government agencies and civil organizations para nang sa ganun mas mapaigting, mas maayos at mas mapadami pa po natin ang mga government programs, policies and services natin.
At muli nagpapasalamat kami sa mga participants nandito and also virtually, and definitely sa ating speakers and reactors, and to our regional technical working group na nandito ngayon.
Muli ako po si Attorney Joanna Goyagoy.
At ako po si Dr. PJ Libenwasan.
And this has been the Season 1, Episode 1 of the Dagyaw Open Government Town Hall Meetings 2023. Thank you, everyone.
Thank you so much.
Thank you po, sir.